Welcome. Today is always one of my favorite days of the year, our 2024 Women's Health Tech Challenge. Before we begin, all of us at HITLAB want to take a moment to acknowledge our community affected by the hurricanes and send them our support and our hopes that they're doing well. My name is Susan Selinsky, and I'm the co-founder of Ellipsis Health and the director of the Women's Health Tech Initiative. Together with Jerry, Stan, Ainsley, Sammy, and Pallavi, we want to thank you for sharing your Friday with us to celebrate women and children's health globally. This year, we received over 150 applications from founders all over the world. And as we serve a diverse community, we have kept this as a virtual event. You'll meet many of our founders in the networking session during the last hour of our challenge. And we have innovators tuning in from all time zones. Today's agenda is jam-packed with exciting conversations and groundbreaking innovations in women's health. We'll begin by discussing the critical support female founders need to scale their startups, followed by a visionary look at the future of women's health from leaders shaping cutting-edge research. You'll hear from our incredible judges, and later we'll be introduced to 6 remarkable finalists pitching their transformative ideas. And we have a special self-care session that is sure to be a favorite moment of today. We'll also learn from 4 trailblazing women executives leading our country's top payer and provider systems and IT teams, culminating with a keynote from Esther Dyson, a true pioneer in health and innovation. Finally, after giving our finalists their prizes, we'll transition into networking and breakout sessions for a chance to meet and connect with fellow founders, investors, innovators, and industry leaders. It's going to be an extraordinary day of learning, collaboration, and growth. And with that, I'd like to thank HITLAB for their commitment to women's health and their ongoing commitment to digital health. It's my great privilege to introduce our chair, Stan Kashnowski, to thank our sponsors and present our first panel. Over to you, Stan.
Hi, Susan. And again, really appreciate Susan for all the good work you've done in putting this together, her leadership as director of the Women's Health Tech Initiative, and the power behind the Women's Health Tech Challenge has been extraordinary. So thank you for that, Susan.
Thank you.
And really happy to have with us our panel of, I wouldn't just call them supporters, but they are really linchpins of the ecosystem in digital healthcare, with Victoria, Chris, and Teresa coming in from Witham, Goodwin, and Femivate. It's just incredible when we look at the ecosystem in women's health tech and we look at the cornerstone of it and what it consists of, and just how extraordinary these folks are in making sure that we have the very best support to help build up the very best companies. It is amazing to see what they've done, and looking forward to the panel now and talking with them. So welcome, everybody. We wanted to hear from some extraordinary support system providers here and hear more about that. Let's start with if we could just get like a 1-minute thumbnail from each of you just on your backgrounds, and we'll go the way I'm seeing you on my screen at least, which is clockwise, with Victoria and then Teresa and then Chris. So Victoria, if you could start off with about a minute or so, since we're short on time, and then Teresa and then Chris. Go ahead, Victoria.
Absolutely. Great to see everybody. So my name is Victoria Izzy. I'm a senior manager at Witham. Witham is a top 20 accounting, tax, consulting firm. In the firm, we have our technology and emerging growth industry group. I work within that industry group mainly with auditing and financial statements, but we also have our women's health and wellness group. That's part of our emerging growth and tech industry group. So, really fortunate that the firm values this space. A couple of years ago, my co-lead and I already had, just kind of generally in the environment, a fair amount of women's health and wellness clients. And so we were like, you know what, this is such an awesome space. It's so important personally to us as well as to the world. So let's try to support, like you were saying before, Stan, and really just lend that helping hand where needed by being professionals to help out these up and coming founders, and then also investors and just the community as a whole.
That's fantastic. Well, thank you for that. And again, thank you for all the support of the ecosystem and the support system here. And Teresa, love to hear about the background of Femivate and what you guys are doing at Gaidea. Could you give us a little bit of background on yourself and your company?
Yeah, definitely. I have to give a shout out to Witham because they have been huge supporters and very helpful. They're delightful to work with, Victoria in particular. So just wanted to put that out there. So my name is Teresa. I am the founder of a design agency called Guidea. We've been around about 20 years. And 2 years ago, we decided to create a women's health incubator to support early stage femtech startups. And in the past 2 years, we have been able to support 60 early stage femtech startups, and they have, we're starting to get some momentum. Let's see, half of them have launched products. A quarter of them are either in clinical or research trials, and 7 of them have achieved FDA clearance. So our theory is that by providing design capital to early stage startups, we're able to help them attract investors, potentially awards through grant programs, as well as get their product, a commercially viable product out to market. And so we wanted to pair up with HITLAB because I think we're kind of doing the same thing of supporting early stage femtech founders who really need that critical boost to get started, to really start attracting investment and strategic partners to bring these inventions to the world.
No, it's fantastic. Absolutely. And I think, again, no one thinks about women's health and doesn't think about Goodwin and Chris. As I try to go to as many things in New York City as I can, and Boston and whatnot. And Chris, I think, goes to every single one, sometimes 3 or 4. It's just unbelievable. He's such a supporter of the women's health tech ecosystem. Chris, thank you for joining us as a male ally. And again, if you could provide for those few of you who've been living in a cave and don't know about Goodwin and don't know about Chris Brown, if you could do a little bit of background on yourself as well.
Well, that's a very, very kind introduction. Hello, everyone. My name, again, is Chris Brown. I'm a partner at Goodwin in New York City. I've been focused on this area for probably about 30 years, believe it or not, but it's only in the last maybe 5 or 6 years that Goodwin formed a women's health and wellness sort of subgroup to really focus and narrow in on this key industry sector. And frankly, it was to kind of erase some of the taboos that existed in the system, in the ecosystem, to also kind of show that we were leading a charge here, and to maybe normalize it if it needed such a direction, and to make sure that we brought to bear our connections to capital, angels, and just experience around how to deal in this somewhat mysterious world of raising money for this sector. I, in addition to being a lawyer who works with just a ton of startups in again, the ecosystem, I've been an angel investor for about the last 20 years. I actually put some of my own money where my mouth is into this ecosystem. Beyond this sector, I've probably been the first or second investor in about 90 companies over that time. And so I think I and Goodwin like to kind of bring to bear all of that experience as we help these companies. And the group on this in this chat is a great one for you to consider networking beyond kind of the legal, accounting, and other expertise they provide, because I know at this stage just kind of getting introductions to partners, to money, et cetera, is super important. And I think everyone would agree that that's a role we like to play and hopefully can help you all with. My details are in the chat. I hope you'll reach out. Thanks again for this opportunity. I look forward to this discussion.
No, likewise. And again, let's double click on some of this. Again, you were all very, very kind to stay within the kind of 60 to 90 second range, just so we can get to everybody. We'd love to hear more about your background, your company's work, and how your companies are supporting the women's health tech ecosystem. And again, we'll go reverse counter now on my screen. So we'll start with Chris and then go Teresa and Victoria. But talk about some of the more tactical stuff, maybe some case studies where you've helped a women's health tech company, something like that. And again, I'll keep it about 90 seconds just so everyone can get a good shot at the answer here. Go ahead, Chris.
Well, I think maybe it started within Goodwin when I was asked to speak to really the firm about this ecosystem and this sector, perhaps about 8 years ago when we first decided to put in place a specialty group. And I think something that I tried to do back then was talk about things like pelvic floors and menstrual and periods and issues one has around female sexuality that, again, were sort of taboo, and to have it coming from kind of this middle-aged white, male to this whole group, I thought was a way to perhaps, again, kind of make this more in the public sphere, because again, for whatever reason, it was really hard for people to talk about this stuff. As easy it was to talk about erectile dysfunction, it wasn't really possible to speak so freely about, basic fertility issues. So that's one way in which I kind of felt helped jumpstart the set of conversations, which again, now maybe that seems old-fashioned to even raise, but I think we've, fortunately seen quite a lot of change in law firms and accounting firms and really conservative places historically over just a very few number of years. And thank goodness, because, with that, a lot of people reached out and said, hey, thanks for doing that. I've got a client that's in this sector. What do you think? And again, bringing that openness and bringing that ability to talk about things that I guess people, feared somehow to talk about, which is absurd, to our, again, largely male-led venture firms and groups of angel investors initially, and making sure that this was something that could be discussed and was interesting and was a big market. And this was a group of people, who had a lot of money to spend. And so this was meaningful. Making sure that happened was something, again, I thought I kind of did somewhat tactically early on. But again, I think just naturally, because it makes a lot of sense to do that.
Fantastic. Teresa, again, double click on everything you're doing at Idea and Femivate, and maybe some case studies on what you guys are doing to help women's health tech companies.
For sure. But I wanted to follow up a little bit on something Chris said as well. I've spent my career 25 years in tech. Until I got into women's health, I was actually uncomfortable speaking about my body or women's bodies or women's health issues. It was a very interesting first couple of months moving into women's health. I don't think feeling a little awkward is only what guys are experiencing. I think anybody can feel a little uncomfortable in this space, not knowing what is going to be received well by the folks that you're talking to. So I appreciate anybody who's normalizing this, and I had to kind of get comfortable really quick so that I could do our best to engage with teams. So the program that we run is an annual program where we do a global call for applications to find early stage, so pre-seed, seed, and Series A femtech companies. We have a history of working with very early stage startups in the tech world and have 7 or 8 unicorns in our portfolio. So we're very familiar working with startups, but moving to women's health has been, like I said, different than working in straight tech startups. And so for each team that we work with, we create a bespoke research and design project plan within the constraints of the sponsorship that we provide. So it's a pro bono sponsorship. We wanted to make sure that everybody felt comfortable applying to us and not worried about dilutive funding or should I give this company equity? We were just like, look, we're here to give. We have skills. We have experience with regulated devices, wellness apps, digital health. Let's bring that to early stage founders. So we create these bespoke plans, and then we have our team from Idea work with the founders and their team to execute on the design and research. So every project we've done is different. And it's been a learning experience, I think, for us as well as the founders. We have founders coming in from the functional side of things. Maybe they're clinicians, so they run their own practice, but a tech company is new, or maybe they're coming from tech and the world of regulated healthcare is new, and that's quite a ramp up. Or we also have founders that are coming from lived experiences, and they are on a mission to ensure that nobody has to suffer like themselves, their daughter, their wives, their grandmother, whoever it is that's kind of spurred them to move a product ahead. And they might have to ramp up on tech and the healthcare ecosystem. And so we try to fill those gaps in addition to the design and research work that we're doing.
It's fantastic. And what a great way to help people out. There's so much need right now in design for sure. And again, I think going back to Victoria and double clicking on how your firm is helping so many folks. Again, was that the reception you guys threw last week? A phenomenal, great time to meet so many key stakeholders and leaders in the ecosystem, and ran into folks who had been working with you and just love the work Withum's doing. Maybe you could double click and talk about some of the women's health tech companies and how you guys are supporting them as well.
Yeah, absolutely. I mean, overall as a whole, we really try to sponsor as much as we can and be as involved in the space as we can, right? Like we really feel providing founders and early stage women's health and wellness startups with these insights in accounting and kind of how to think about their company from the books perspective, right? Which I know everybody, when they're getting started, they're very focused on the drive and the operations, which they should be. But how can we help them be prepared from a book's perspective, right? As you move forward with investing, that becomes a really big part, right? Do you have a solid set of financials? How are your taxes looking? How are you thinking about sales and use tax? Have you had a tax study done? All of those kinds of things. While they might not be the fun highlights, we try to provide that information early on and at least give some tips and tricks if maybe folks aren't at the place where they need a professional to come in. At least they have some ground level thoughts of, hey, when do you need to have a professional come in to help you out? Other things that we do is we do have outsourced accounting opportunities as well. So for folks who just don't have the time to be in QuickBooks, you can reach out and we can connect you with our outsourced accounting folks. But from women's health and wellness and women founders in particular, we have our industry groups where, again, we're supporting the space, but we also try to bring together, like you were saying, through our various events, people from all different areas to gain the exposure. So in particular with our women's founders, we typically have an event every year with our financial services group, right? So we try to connect some folks that are part of the VCs or working with the VCs with maybe founders that are, female founders. So in general, we really just try to bring people together. We want to be there as a support for these folks and again, excited personally as well as professionally to be able to help move these causes along and bring awareness to the space.
It's fantastic. And just the last question, we've got to wrap up in about 2 minutes. So try to, if we can, keep it within like 30 to 45 seconds each. We'd love to hear any advice that the three of you would have for startup founders, women in women's health tech, executives, folks who are leading these companies that are going to make healthcare more accessible, more affordable for women, not just around the country, but around the world. And again, we'll start now from your side, if you could, Victoria, and just maybe some parting words and advice that you would give them in terms of what they're endeavoring.
For sure. I mean, some things that I would definitely start with, and obviously this group on this panel is a wonderful example of this, but just have a great team of experts there to support you, right? Like, I think that's the number one thing is when you're ready for the experts to step in, make sure that you know and you trust the folks that you want to work with and that they can kind of see from where you are at your stage for your company, right? And can kind of help guide you along. Like I kind of already said, don't discount a good set of financials. Don't discount having a good tax person. Having that from the ground up can help save you a lot of headache later on, which I'm sure Teresa and Chris have seen with other companies that maybe didn't have that stuff set up right away. And then also just, again, from the accounting perspective, be mindful of your runway. I think that's the number one thing, right? I know everybody is really eager to get these investments, get their Series C, Series A, and really kind of bring that money in, but just know where is that going to lead, right? Okay, you got this, this $1 million investment, fantastic. How long is that going to last you? When do you need to raise your next round? Just be mindful of that because it can go fast, right? Especially this day and age. So those are kind of my tips and parting words from an accountant to be mindful of for all of our women's health founders.
Great. Teresa, same question for you.
Yeah, well, I have so many tips, but I don't want to go into tactical design tips. I think one of the things that's really standing out for me as we're working with early stage founders is founders are always really eager to get to the screens. But what's most important at the very beginning is finding product market fit. If we don't have product market fit, we're not going to be able to pull off a great product, even if the screens are amazing. So that upfront work to determine product market fit, who's going to buy this, what are they going to pay, is really critical. If you're getting started with that right now, make sure you do a competitive analysis and be very, very clear on what else is going on in the industry We get hundreds of applications every year for FMFA, and we see a lot of duplication. And I think it's because people aren't quite familiar with going out and doing a competitive analysis and really understanding who else is out there and making sure that you have a clear differentiator that can't easily be copied by somebody else already in this space. Another tip would be, as you're moving forward and selecting anybody that's going to be supporting your team, maybe it's in accounting, maybe it's in law, maybe it's engineers, maybe it's a design firm, get 3 bids. Why? So you can learn. If you haven't already brought tech products to market, this is a great opportunity to learn. And I would say it's crucial, because if you're going off, referrals are great. If you're going off solely or off of a referral, you're not really getting a good picture of what else is out there. You might and ultimately go with the referral, but meeting 3 different companies, seeing how they're going to approach it, who works best with you, what's the best fit for this time in or phase of your company. We tell all of our teams 3 bids, because then you can see exactly how they're going to approach the challenge, and it might uncover a blind spot for you. So those would be probably my key tips. Start with product market fit, really understand your competition. And then as you're selecting groups to work with, make sure that you're doing a good job and looking broad to see who's going to be the best team to help you for this particular stage.
It's fantastic. All right, Chris, bring us home. Give us the last 3 tips you'd give here.
Some excellent advice that was just given by my 2 co-panelists. Maybe mine's a little bit overlapping, but I'll say that the narrative, the story that one is telling is so critical to both bring in the investment that you need and to advance the company commercially. And so I just see far too many people spend not enough time going at a problem perhaps that they're trying to define in many instances, versus identifying a problem and coming up with a solution. So it's an old adage here that a company to succeed can't be a solution in search of a problem. There needs to be a big market opportunity, a big hole that you're filling with your offering, and how one tells the story about how you will address that big problem is super important. And people like accountants and lawyers and investors are often very willing to spend time with you at the very beginning stages to make sure that that story resonates. And that story, by the way, changes in terms of how one tells it depending upon the state of the market. I look back on my career, and there have been about 6 sort of economic cycles. And, we all know we're kind of coming out of a pretty difficult one now, and that's pretty exciting that we're hopefully going into an easier time to raise money. But, in all of those cycles, there's money to be raised, and it's just how one tweaks one's narrative a little bit. Humans are really, really drawn to a good story, and I joke, there's a big difference between, what Elizabeth Holmes was doing with Theranos versus what, a founder should be doing in terms of getting people excited about the potential of their business, telling them about this big problem that no one's figured out how to solve, and explaining how they've developed a solution that's proprietary in some way or can't so easily be replicated without a lot of time and effort to go after that big problem. And, so take some time to practice that story, look at your deck, share it in front of friends and others and people who have a lot of experience, and make sure it's kind of up to date again with what's current before you go and pitch your first angel or investor.
Great advice. What a way to end it out. And again, thank you all, Chris and Teresa and Victoria, for joining us today.
Thank you, Stan, Chris, Teresa, and Victoria, for your sage words to all our founders. And thank you also for your support of the challenge. And now we're going to move to a fireside chat that I have been looking forward to all week. I'm excited for our community to hear from 3 women in healthcare who care deeply about meaningful innovation to improve the lives of women. So would you please introduce yourself, Sarah and Jennifer? And thank you again.
First of all, Susan and the entire HITLAB team, I just want to say thank you so much for including this important topic in today. It's going to be really, really fun to meet these incredible speakers and to hear what they have to say. Over the course of today, we're going to hear from some companies who are bringing some important innovations to market. And some of the things that you're going to hear about were born of science. And that means that it took anywhere from 5 to 10 years for those companies to get to this point because they went through a cycle of discovery, clinical research, regulatory process. And what that means is that the things that are going to make a really big impact tomorrow are in the lab today. Maybe if the right questions are being asked, and maybe if the funding is happening to allow that basic research to exist. Now, when we talk about women's health, what are we talking about? We're not just talking about things that are only women. We're talking about things that are mostly women and that are different in women. And that means there's a lot of questions to be asked, some of which, until this moment in time, were never being paid attention to. So it's with great pleasure I get to introduce you to two women who are setting the agenda, who are asking the questions, and who are doing their best to make sure that those questions get funding at the very earliest stages. So Dr. Garrison and Dr. Temkin, and from here on in, I'll probably refer to you as Jennifer and Sarah. Thank you so much for joining us today. And I think the first thing that I'd like to do is just have you introduce yourself, explain the institute that you're with, and tell us a little bit about how your careers got you here. So Jennifer, we'll start with you.
Thank you, Anna. And thank you, Susan and Dan and everyone who invited us to be here. This is an amazing audience, and I'm so glad to have the opportunity to talk to you all. So I am actually a research scientist. I'm a PhD scientist. I trained as a neuroscientist, so I didn't start my career thinking about women's health. I have a lab at the Buck Institute for Research on Aging, which is about 20 miles north of San Francisco in Marin County. And I also have appointments at UCSF and at the University of Southern California. Now, my own research lab is really focused around trying to understand the brain's Wi-Fi, so how the brain communicates with the rest of the body and how that changes with age. And about 6 years ago, we got really interested in the brain-ovary axis. Now, at the Buck Institute, we are interested in understanding basic mechanisms of aging as a way to extend human health span, not lifespan. And as it turns out, although females live longer on average than males, they have reduced health span, meaning if they're lucky enough to live to old age, they are going to spend a longer period of their lives in poor health. And to me, that was shocking. And we started a center here at Buck to increase research around this question of why do females have reduced health span and how can we extend it? And it really comes down to the fact that ovaries age faster than the rest of the tissues in a woman's body. So the fact that ovaries are aging faster means that females essentially have reduced health span. And so we started a center and a global consortium. So nonprofit, we're not making companies yet, but we're trying to essentially stimulate research that's at the interface between reproductive biology, which is a mature field, and aging science, longevity science, new research that's at the interface there to try to understand what are the underlying drivers of ovarian aging, not as a way to preserve fertility, although I think that that's probably going to be a side benefit, rather to extend the number of healthy years that a woman has. And this is profound because it's not just about fertility and menopause. That's how a lot of people bookend this conversation, but it's rather that when ovaries aren't working properly at any age, it uncovers different health risks. And so for a teenager, that might mean if her ovaries aren't working properly, issues going through puberty or irregular menstrual cycles. For a woman in her 20s, it might uncover risk for things like PCOS or POI. So it's not just about fertility and menopause. It is truly about health across a woman's life. And so we give away grants to basic scientists to stimulate research in this space, and we build resources to try to help that science move faster and to create bridges between scientists, clinicians, early stage founders, funders, policymakers, anyone who has an interest in the space. I'll stop there. Sorry, I didn't mean to go on a diatribe.
I get excited when you speak, so I was with you the whole way. But let's turn it over to Sarah. Sarah, same question for you. Explain your institute and tell us a little bit about how your career got you here.
That mute button, it's still like gets you every time. So I am the Associate Director for Clinical Research at the NIH Office of Research on Women's Health. And the Office of Research on Women's Health is an office, one of many within the Office of the Director in the NIH, that was created in 1990. So not actually that long ago, with the primary goal at that time of inclusion of women into clinical research that was federally funded. And I think for many people today, it's sort of shocking to think that just really a little more than 30 years ago, that women were routinely excluded, especially women of childbearing age were routinely excluded from clinical research. So, with the life cycle of development of drugs or for other interventions, medical interventions, that means many of those things were never tested on women. And so the role of the office in 1993 became to ensure that the mandate from the NIH Revitalization Act that women be included into clinical research was applied and integrated across the NIH. I personally came into the office in 2021. Years are starting to blur. And specifically to respond to a congressional request that the NIH review its portfolios on women's health research. And I think that was timely for a number of reasons. There were three focus topics that were maternal morbidity and mortality, cervical cancer survival, and I'm so happy that Jennifer you talked about chronic disease, because that was the third of the topics that has really become an important focus of my work in the NIH, is ensuring that chronic conditions that are female specific or disproportionately affect women or present and progress differently in women receive attention across all 27 of the NIH institutes and centers.
Excellent, excellent. Sarah, can you take a moment? I described a little bit that the innovations just don't pop up when they're ready to go to market, and the vital role of basic research. Can you just elaborate a little bit on that cycle so that the innovators in the room have a picture of what they might be radar up for?
Sure, and I think some of this is comes from my background as a clinician scientist, because I am a physician by training and an oncologist by training. So nothing that gets applied to humans in the clinic is pulled out of thin air, right? Like, it takes a very long time, as I heard other people mentioning. But about the NIH has a very large budget. It's the biggest biomedical research funder in the world. This year, the budget is expected to be $50 billion, and about half of that budget goes towards basic and preclinical research. And so that is, I think, very important to this audience, because when the federal government is investing in basic and preclinical research, then that provides a platform of discovery for people who have interventions that are going to be meaningful to the clinic, that they can use those and apply them to patients and figure out how to best use them to patients. And so that is one of the main roles of the NIH. And historically, the NIH has spent about 10% of its budget on women's health. And so that's important to know. And, we hope that grows, but most of the research that gets funded by the NIH comes in what's called unsolicited, meaning that people send in an idea for research and it's reviewed and the meritorious applications are funded. So the more applications that we receive on a given topic, there is more opportunity for us to fund in a specific area. Great.
I'm going to move to the topic of what are the questions that haven't been asked. So when you see a piece of when you have a chance to fund a project and it's looking at something and you say, wow, this is an area where we really, really need to know more. Just from your experiences, I'd love each of you just to tell us about one thing that's on your radar, how the heck did we just not know about this? Jennifer, do you mind starting?
I don't mind at all. Honestly, we don't understand how female bodies work, full stop. And we know so little about how to take care of women. For me, I think the most compelling and driving question is what what is the underlying mechanism that's driving ovarian aging? Like, why are they aging faster than the rest of the tissues in a woman's body? Why does it happen at all? Right? Human females are odd in terms of our reproductive strategy, and also in terms of the fact that we go through this thing called menopause. In the animal kingdom, it's really rare. So that means to me that it's not a biological imperative. So what is it that sets it in motion? It might be one thing, it might be multiple things, it might be multiple cues and timers. We genuinely don't even understand the most basic things about it. And I think until we have that answer, until we understand what's causing it, we can't intervene. And so everything we're doing now, everything we have available now is a Band-Aid. And they're very important Band-Aids, don't get me wrong. I'm so grateful they exist and are being developed, but I think we can do better. And so for me, it's really about understanding how ovaries work and why they're aging faster than the rest of the tissues in a woman's body.
Wow.
just a little thing.
Sarah, what's on your list? What's on your list of things that we either just don't know enough about, or maybe even nothing?
Oh, I mean, I'll add a +1 to what Jennifer just talked about. And I think I just want to make everyone aware that, midlife health and the symptoms of menopause and understanding the basic pathophysiology of menopause is one of the highlights of the White House executive order on women's health that was published in the spring of this year. And so, we are very interested in understanding more about what in menopause is normal, what is not normal, how do we treat those not normal things, which is very difficult to know if we don't even know what's normal and what's not normal. And I'll extend that to some other things, which include pregnancy, right? We don't know very basic pathophysiology around what is the spark that causes somebody to go into labor. So that makes it difficult to intervene in things like preventing preterm labor. In terms of the menstrual cycle, the same thing, and how each one of these things across the female life course influence the course of disease is very different. I mean, I'm so glad that Jennifer brought up this thing about women living longer with disease, and those diseases start at younger ages in women also. So, potentially having PCOS or endometriosis at a younger age influences the disease course and trajectory of a woman as she ages and develops hypertension or cardiovascular disease. And I think it's very important that we understand those things while keeping women, keeping those hypotheses centered around the healthcare needs of women.
Excellent, excellent. Quick question, big answer, but quick question. Do you think 100 years from now we'll look back on something that is sort of in medical practice with women today and feel about it the way that we feel about using roaches to bleed people and make them like, is it possible that we're at that sort of primeval stage today? Jennifer, I saw you nod.
I mean, yes. I think a lot of what we do to women is primitive at best. I have used other words to describe it, but I will refrain from doing that right now. I think that a lot of what we do is the best that we. I don't want to demonize physicians either. I think, physicians are amazing and they're doing the best with what they have. But because we have this complete lack of knowledge, many of the things we do with women's health are really barbaric. I mean, IVF, for example, it's not a very kind thing to do to your body. Trying to diagnose something like endometriosis or PCOS can take 10 years, and all kinds of invasive, sometimes surgical procedures. It's crazy that we can't just have a non-invasive diagnostic marker for something that is so prevalent among the population. I think the way that hormone therapy is administered today, I mean, it's an amazing Band-Aid, don't get me wrong, I love it. However, it hasn't changed since it was introduced. And that's because, we shouldn't get derailed by why that is, but, there's so much opportunity for innovation, and just doing some simple things to bring a lot of the treatments that we have for women into the modern world, I think. Yes. I hope that we'll be moving past them very soon.
I want to say that was such an excellent answer, but that seems inappropriate. That was a big answer. Thank you. Sarah?
No, I'll agree with that, and I'll just, something I'll point out is like progesterone might be the most widely prescribed medication in the world. I don't know that for sure, but I know lots and lots of women are prescribed progesterone in some form, and we really literally don't know which formulation or which delivery method is the safest. And so I think there are a million questions out there to ask. I think the one thing that I think we'll hopefully look back on, and I'm going to just say something that came up in the last session, is around stigma, like the fact that women and men in 2024 are still like embarrassed or stigmatized to talk about menstrual cycles. I hope that we find that very shocking in 100 years from now.
Great. Now, this conversation could go on a long time, but I'm going to have to probably wrap it up with this question. So you've got an audience here. You've got an audience here of innovators, investors, regulatory, people who are working on the regulatory side. You've got a really diverse audience. What is like one thing you would hope one of those sectors, it's hard to embrace all of them, but is there a sector in particular that you'd like to address a message to, having really informed us all about some really important work that still needs to be done? I'll actually mix it up a little bit. Sarah, why don't we start with you and then we'll go to Jennifer.
I don't know, I have a specific sector in mind, but I just want to encourage people to really talk to women, find out what their needs are, and listen to the sector, because what women have been told that they need from the medical establishment might not be exactly what they need. And I think by listening and giving women a platform and centering science around what it is that's important to women, that I think that's hopefully where we make a breakthrough towards having women get more comprehensive care that is working better for them, so that some of the disability that they and the morbidity that's experienced across their lives can be reduced.
And Jennifer?
Well, I would address everyone. I think we're at this incredible moment where things are changing, and that's, it's all very positive and it's all going in the right direction. I think that, we are coming from a place where the male body has been biology's baseline for the last 100 years. And so we have a lot of ground to cover. And the lack of data is directly related to the lack of funding. What we fund dictates what we know. And so that's also on the private side. It's not just, that the funding that happens in the public sphere, the NIH and other governmental bodies like that, it drives funding on the private side. And so funding on the private side is just as dire, like less than 4% of R&D budgets at pharma companies, less than 4% of investments is going into women's health. And so I think if you're a funder, this is something you need to pay attention to, because those numbers haven't changed over the last 5 years, and that's concerning. Because there's a huge market here, but also we have to do the science to generate the IP to make these companies. And so as much as, the policymakers, lots of great things happening on the public side, but it's slow, it's really slow. So think about the funding, what I would say.
Excellent. We actually have been given the grace of a little bit of time. And so I get to pick a question from the audience. This is teeing off of something that you said, Jennifer. Where do you draw the line between longevity and quality of life, especially as it relates to underserved populations?
Oh, that's a great question. So it's really important to make that distinction that we are not interested in longevity per se, meaning like we're not trying to extend lifespan. There are those in the aging research field who want to, extend lifespan, but that's, from model organism research, we know that we can extend lifespan, lots of model organisms, sometimes 20-fold. But what happens in every single one of those cases is you have the period of time where you're healthy, the period of time at the end of life where you have age-related diseases. And those two periods of time scale when you extend lifespan in model organisms. And so that's a nightmare scenario from my perspective. So we do not want to extend lifespan. We want to extend health span, the number of years you're healthy. So just like square off the curve. And once we've solved that problem, then I think we can turn our attention to longevity. So that's a really important distinction. And in terms of underserved populations, I mean, I think women in general are underserved by a mile in terms of the healthcare system. And then minorities within that population are also dramatically underserved. So thinking about equity as we extend healthy longevity is important from a lot of different angles for sure.
Excellent, excellent. Sarah, do you want to add anything to that?
No, I love the answer, and I also just want to stress that equity is, of course, one of the priorities of the NIH, and making sure that discovery is available to everyone, and healthcare interventions are available to everyone. And our office actually runs something called the U3 program, which is called the underserved, understudied, underreported women, to just to support research that explores these intersections of gender, race, and other social factors like geography, so that we can better understand how to deliver healthcare and interventions to everyone.
I love that U3 thing, and I actually participated in it, Sarah. So for those of you who are interested in equity among the women at NIH, you should read that report.
Great. I cannot thank you both enough. That was an amazing, amazing panel. And I think you've given us all a lot to think about. And thank you again, HITLAB, for having us.
Anna, thank you so much. And thank you, three. Wow, I could listen to each of you speak every day, all day. We really appreciate your time and expertise. I think you're going to go and you're going to see the chat, and there's just a lot of love for all the work that you're doing. And thank you so much. It makes such a difference. So we are now moving on to introduce our judges for today's competition. And I am elated to welcome 4 powerhouse women in venture who will serve as our judges today. And they're going to evaluate our 6 finalists. These visionary leaders are not just experts, they're trailblazers. They're driving the future of women's health through groundbreaking funding and innovation. So as founders, we can see an unmet need, we can solve a problem, we can create a product, but it takes venture funding to fuel our companies. So it's really important to understand the perspective of these 4 judges as to how we can all move faster. How can we create the change we want to see in women's health? So Courtney, let's start with you. Would you share your background? Tell us about your fund and a little bit about your investment thesis.
I would love to. Thanks for having me, Susan. It's you who is actually the trailblazer, and I always love doing stuff with you. So hi, everyone. My name is Courtney. I'm based here in New York. I'm a founder and managing partner of Springbank, which is a $40 million venture fund. And we say we're investing in the infrastructure that serves the overlooked and unmet needs of women and working families. So we have about 20 investments in the portfolio. Our check sizes are usually about $750 to $1 million. And we just love working with founders, men and women who are solving, for these needs that have been really overlooked in the market, with a lot of grit and determination, and the sense that a lot of things which historically maybe have been characterized as women's issues are increasingly manifesting themselves as economic issues, labor market issues, massive demographic issues. They deserve a lot more investment than they have received. And I think the macroeconomic and demographic climate, and certainly some changes in just social attitudes and culture, are providing incredible tailwind for these categories. So I'm really excited to hear from everyone today.
Thank you. And CJ, would you introduce yourself and the fund?
Sure. Hi, everybody. I'm CJ. It's so nice to be with you. I agree with Courtney. It's not the 4 of us who are the trailblazers. It's all of you who are out there building something from scratch in what is still a tough and sometimes disheartening market. I'm a physician and a co-founder and general partner at Convergent Ventures. We invest in seed and A teams that are outstanding and building at the intersection of data and any of biology, chemistry, or physics. On the health and life sciences side, we are looking, I am looking for great deals promoting the health of women. By background, my background spans clinical medicine, health systems, and health plans. So I have that holistic view on the regulated side and really interested in better meeting women's needs, not just in reproductive health, but in things like cardiovascular health, autoimmune, those sorts of things I'm sure you guys talked about earlier today. I think investing, especially private investing, is a great lever to pull. And I always say women's health is a movement as much as it is a sector. It's going to require all of us working together across research, public institutions, and private funding, like the kind that the four of us do. I was a lead partner or a venture partner for Portfolio, which had one of the first dedicated women's health funds. So you could check out that website to see some of the work that we've done there and are continuing to advance. And I also do a fair amount of policy and subject matter expert work. I think to my point of this being a movement, policy and advocacy also go a long way. So I'm just thrilled to meet you, to learn from you, to hear what you're building. Thank you.
CJ, so beautifully said. It is definitely a movement, and it's definitely going to take all of us. Julianne, would you please introduce yourself and the fund?
Yes, thank you so much. So I'm Julianne Roseman. I'm principal here at Plug and Play. We're an early stage investor. We're a generalist investor, and then we specialize by different industry areas in our team. So I focus on our healthcare division, and we're a global investor as well. So we do look at innovations around the world, but we're primarily seed stage, looking at B2B solutions that sell into either payers, pharma, or provider. And we do also do some consumer health work as well. And we love supporting both female founders and women's health solutions. And our platform is quite unique in that we don't just invest in startups, but we also connect other startups to corporate partners in our ecosystem. So even if we can't find an opportunity to work together on the investment side, we may be able to help in other ways. And really excited to be here today.
Thank you very much. I hope everyone notices that in the chat, each of our judges' information is going up on LinkedIn. So please feel free to link in with them. And I should have said at the beginning, I know we have a lot of investors here that are also LPs in funds. So if you're interested in that, please also reach out to these four. And Donna, if you tell us a little bit about yourself and your fund.
Hi, everyone. Thank you so much for having me here. My name is Donna Sun. I'm a principal with the Laerdal Million Lives Fund. We're investing out of a $100 million early stage healthcare venture fund with the mission of backing life-saving technologies to help save 1 million lives annually by 2030. That's why that goal is literally embedded into our title as the Million Lives Fund. And within that, we're really focused on a couple areas that are driving high mortality and really time-critical situations. Everything ranging from frontline critical care to maternal and infant health and beyond. And so within women's health in particular, we certainly want to be making a lot more investments there. Although there's been some progress on policy, on research, on innovation and funding, I think honestly, I'm still a little bit angry that progress hasn't been more, but I think every little thing we do as a community, like communities and events like this, helps us, continue to accelerate that process. So again, really happy to be a part of this and excited to move forward here with the group.
Thank you so much. And we're going to be hearing from our judges very shortly. We have a surprise now. We are going to do a little mini meditation from Michelle Hoy. And I am just thrilled to introduce the remarkable. Michelle is one of my favorite clinical leaders in behavioral health. And I've had the privilege of being through what she's going to guide us through. And it's something that kind of always level sets. So we want to welcome you to the stage, and we look forward to this moment of calm and clarity.
Thank you so much, Susan. Hello, everyone. I am Michelle Hoy. I am a therapist by training and a new co-founder and head of clinical operations of a seed startup, Vitalic Health, redesign health company. And we are aiming to be the first specialty geriatric behavioral health provider. When I think about self-care and caring for others, this population is one of the most underserved in behavioral health. And we're really excited to bring something new and different to the older adults in the United States. or a B2B2C model, looking to work with our first customer and first pilot here in December. I appreciate that all of you are here. As we start today, please feel free to go off camera. Get comfortable in your chair or wherever you happen to be sitting. We're going to just do this exercise, this meditation, to help you prep for the amazing afternoon that you have coming up. As you settle into your chair, have your feet touching the floor, settling in. Get your arms and your hands in a comfortable place. Close your eyes if you're comfortable. We're going to begin by taking a deep breath in through your nose and holding it in. And then breathing out through our mouth, slowly and gently. And another breath in through your nose and out through your mouth. Just breathe for a couple of cycles. As you're breathing, we're going to think about gratitude today. And we're going to begin this practice of gratitude by just noticing something simple that you're experiencing right now. It could be something as simple as the warmth you feel from sunlight hitting your face, the comfort of the chair that you're sitting in. We're going to choose one simple thing in this moment that you're grateful for and allow it to fully absorb into your experience. Letting appreciation and gratitude arise and fill your body and your mind. Continue that breath in through your nose and out through your mouth. As you start to feel this feeling of gratitude, I'm going to ask each of you to reflect on someone you might not know well, who's supported you being here today in some way. It could be a person who told you about this event. Could be somebody who helped you get registered. It could be somebody who stocked the food at the grocery store that you ate to nourish your body this morning. Could be the person who created the device that woke you up this morning. Allow yourself to feel how you benefited from this person and the gift of the work that they did. And as you're breathing, extend gratitude to that person wherever they may be in the world. Now let's think about the tools that you use to support your work. Tools like your computer, your equipment, your building or home that you're sitting in right now. Consider all that was needed for this creation and how it benefits you every day. Again, let that gratitude for these simple things that we might not think about every day just fill you and send thanks out. As you breathe in, you're breathing in gratitude and you're sending it back out to others as you breathe out. Saying thank you to those people who helped today. Now bring your mind to something in particular that you're grateful for today. Something that's maybe made a difference to you already. It might be a smile someone had, kind words. And again, give gratitude and appreciation for that small act today. Allow yourself to rest in this experience. When you cultivate this practice of gratitude, you might find yourself able to be grateful for even difficult or stressful experiences. You might bring to mind something that might be challenging for you or stressful, and bring forward gratitude for that situation, person, event, for challenging you and offering you room to stretch yourself and learn. Offer your appreciation. Expand your gratitude throughout your entire body. Let it fill you. Visualize it moving around with your breath in your body. Be grateful for this breath that keeps you alive in this moment. And all of the things that we've talked about today. Finally, we'll take a moment to appreciate this opportunity for a small pause in a very busy day. Gratitude for allowing yourself to sit in this moment and for your mind to have brought things forward to give gratitude, for thinking of the small, countless gifts in your life. You may say thank you again to them and extend that to people and things around you. That gratitude is in you. It's part of you. As you breathe in and out, it will carry you through the day. And as you settle your mind on your breath again, in and out, here and now, you're fully alive and you will be present in the moments as this day progresses. You're ready for what's to come. Grateful for what's to come today. We're going to take one last breath in through our nose and out through our mouth, and then start to come back to the moment and awareness. You might start to wiggle your toes and your fingers. You may move your legs or your arms a little. Maybe move your shoulders around a bit. When you're ready, open your eyes and come back to the group. Ready for a really exciting afternoon.
Thank you, Michelle. This was really just what we all needed to reset. So we are proud to introduce our 6 finalists that are competing today in the nonprofit, pre-seed, and seed categories. Each of these speakers will have 5 minutes to describe her company, followed by 5 minutes of questions from our esteemed judges. Please keep track of your favorites, as you're going to have the chance at the end to vote for an Audience Choice Award. I want to acknowledge that it's impossible for these leaders to explain their company in 5 minutes. So please show a lot of love to these women. I'm hoping the chat will continue to just light up. I see all of the wonderful things going on. Cheer them on, connect with them after, and you'll have a chance to meet each of them in our networking sessions. And if you're just joining us, please make sure and introduce yourself and your company as well. So our first set of pitches will be in the nonprofit category. And I'd like to invite Sissy to take our stage and introduce her company.
Everyone, thank you so much for the opportunity, and thank you, Michelle. I think I'm almost too relaxed, so I might actually speak slower than usual, which is probably a good thing. But Cece Pan, I'm the Chief Strategy Officer at Maisha Meds. I've been a global health practitioner, having lived half my career in Southern and East Africa, and I have been a global health practitioner and am one because I think too many people, particularly women and young girls, still needlessly today suffer or even die due to preventable causes. And I think the fact that this is true is actually an imperative that we need to work on. And as well, I think it compels us to imagine a system that actually serves everyone. So let me tell you a bit about how Maisha Meds tries to do that. So Maisha Meds is an African healthcare technology company operational across Kenya, Uganda, Tanzania, Nigeria, and Zambia. And in our markets of operation, I wanted to share that the private sector, which means mom and pop shops, small drug shops, pharmacies, small clinics, particularly in peri-urban and rural areas, this is the first and sometimes only point of healthcare for the vast majority of people, particularly women. And most of the people seeking care there will be uninsured. They'll only be able to receive the care they need based on how much shillings or naira they have in their pocket. It's very fragmented. And actually, a lot of the drug shops are also women owned. So this is sort of the context in which Maisha Meds works. Next. As a company, and we are founded and led by an amazing woman CEO, Dr. Jessica Vernon, but we are founded to try to solve some of the issues that I stated on the prior page, which is that we want to not only know what happens at the last mile in these more disparate peri-urban and rural areas, but importantly, we want to influence and improve the quality and affordability of care that people, particularly women, receive there. So there's 3 parts to the Maisha Meds technology solution. The first is that we have built business software exactly for those mom and pop shops, drug shops, and clinics so that they can move away from pen and paper operations and they can make sales, manage their product inventory, check their profit and loss, and really just run more fulsome businesses. And again, a lot of these drug shops are women owned, and this is their primary source of income. And in doing so, we've created a network of more than 4,000 such facilities, which is the largest digital network of its kind across the continent. But once we started doing that, we saw the data that was finally flowing through from the last mile, and we noticed there is a real opportunity to improve the quality and affordability of care. So we've built flagship patient support programs focused on malaria, which disproportionately kills women and young children, family planning, HIV prevention, and more. And this is really where we spend a lot of our time and energy, making sure that patients can get the care they need at the last mile. And last but not least, the third part of our technology solution is, everything I described generates real-time data that never before existed because it, again, used to be sort of on pen and paper. And not only does that inform how we build and improve our patient programs, but we also offer this data to governments in the countries in which we work, as well as global health funders, so that it can inform thoughtful policy change and program design. Next. As I mentioned, we have worked really hard to build already a really large network, and I want to just point out 2 things here. One, it's hard work, but we're really proud that our network is predominantly in peri-urban and rural areas in the countries in which we work, because that is where the need is greatest. I also want to share that we have logged 30 million patient visits today on our software, and that's just increasing exponentially. We record 1.6 million every month these days, and the overwhelming majority of those patient visits are from women. Next. I think one thing that's really important for us as we build our patient programs is not to say, wow, maybe sometimes the quality of care at the last mile isn't so great. Whose fault is that? That's just not our approach. I think at Maisha Meds, we really look at the evidence, but we also look at it with empathy. What are the actual human behaviors that happen at the last mile in perhaps a rural area between that pharmacist or that drug shop owner and the patient? And I just want to highlight one thing here, because the evidence sometimes suggests that it's not what you think it is. So most family planning and contraceptive sales that happen in our country of operations happen in the private sector, not in the larger government hospitals. And that's what you see on the left. And we've noticed that in our patient programs, if you hypothesize, why don't women, purchase more longer acting methods that are more effective for them and ultimately less expensive? Why is there so much purchase of emergency contraceptives? You could say, well, maybe the pharmacist just needs to dispense it for free. Maybe it's just that the patient can't afford it. We have to lower the cost more. But what we actually found in a randomized control trial is that bar you see all the way on the right, which is that what really happens at the last mile is an interaction. And if a pharmacist or an attendant or a women drug shop owner isn't compensated for her time, she may not be empowered or may not remember to provide counseling because she's incredibly busy and she knows an emergency contraceptive sale is one of her highest profit products. And so with a very small nudge and a thoughtfully designed care pathway using our technology, you actually see that a small fee for the attendant or pharmacist or drug shop owner's time is actually what increases almost 6x the uptake of long-acting contraceptive methods that is better for the woman patient in the end. So we just really wanted to share that. Grounding in evidence and empathy can really reveal a lot about human behaviors rather than, I guess, scolding them and wondering why outcomes aren't improving. So I guess this is a snapshot of what we do at Maisha Meds. I'm so happy to answer further questions, but I did want to share the ask or sort of where we're at in our current inflection point in growth. So we are extremely fortunate to have had some proven programs such as our family planning program I just described, but also HIV prevention, malaria, etc. And so we are seeking outcomes-based funding from global health funders, from philanthropists, etc., so that we can actually serve over 1 million patients every year through a transparent cost per patient basis. So that is something we're really excited to do. Hand in hand, we always try to think about incubating new patient program areas that really make sense alongside our existing programs. I think something that's giving us a lot of energy right now that we're deeply exploring are things in the maternal, neonatal, and child health space, as well as in the HPV space, which is severely underserved in our markets of operation. And lastly, if everything I described today is interesting, even if it's not just about our model, but maybe about a policy or a program question you have at your organization, we're really open to bring our data to bear and sharing it with you, because in the end, we can't solve every problem, but we believe all the problems as it pertains to women in the areas we work are important to solve. So thank you so much for your time.
Thank you, Sissy. I know you flew back from Nairobi and made all the way back here to pitch for us today. We really appreciate it. I think Donna has the first question for you today.
Wonderful presentation, Cece. Thank you so much. To start off, I kind of have a set of combined questions. One is, how do patients discover Maisha Meds in the first place? And the second part is, what types, you gave a great example about the contraception, but I'm curious, what are the suite of services or offerings that patients typically utilize the most?
Very thoughtful questions, Donna. So one, patients discover us. Our philosophy is that we want to meet patients where they seek care. So we actually don't put it upon the patient to necessarily know, is this a Maisha Meds clinic or not? They are probably already going to their local drug shop, pharmacy, and clinic to receive care. We just provide the enabling software exactly for those providers to be able to give them better care. We are working with demand generation engagement tools whereby we might use short codes or WhatsApp, SMSs, etc., to contact different people. But I think in the case of privacy, especially for family planning and contraceptive care in particular, or HIV PrEP, we actually don't try to do that patient outreach. And again, we just meet patients where they seek care and hope that the providers there can actually provide better care. In terms of the suite of products, we have a malaria program, a fevers management program, a family planning and broader sexual and reproductive health program, an HIV PrEP or a prevention program with new longer acting injectable methods that are coming online. We had a COVID vaccine program, and so on and so forth. So it's all about, if a patient is going to come to one of these pharmacies anyway, which is what they do anyway, we just want that suite of care to increasingly be covering most essential primary health areas and to be higher quality and more affordable without asking anything extra of them, not asking them to download anything, pay more, etc.
Just curious how you actually distribute the software in the first place. How do you go out and get these clinics and convince them to start using it? Do you have really strong ground game? How much pull is there from the clinics themselves?
Yeah, that we usually, there's usually 4 different methods or channels through which we acquire pharmacies or empower them. Number 1, we do have amazing staff in all of our countries of operations. And this is not just in the urban areas. In Nigeria, we're in the north where there's a lot of malaria. In Uganda, we're in the west, etc. So we do have sort of door to door, if you will, right? And a lot of that is really important for onboarding and training, even in terms of the digital and financial literacy of some of the drug shops and pharmacies that use our software. We want to make sure it actually adds value to them. But we also have referrals. It's also just our software is free to download and use off the Google Play Store. So we do also just have organic growth. But I think the 4th channel that's been really important, takes a lot of work, but is definitely one of the highest value, is that we partner with either appropriate local or regional associations, such as the pharmacist associations or the faith-based networks, which is sort of like the powerful and kind of convening nucleus in many of our countries of operations. And importantly, we partner with county or state and national level governments. Because again, we're not trying to build a parallel system. We're trying to bring online and improve the quality of care of healthcare infrastructure that already exists, but for so many years have been underinvested in because it's just not really possible since they're so fragmented.
Great. Well, thank you so much. And thank you to our judges. We're ready to hear from our next finalist in the nonprofit category. And we'll just pull up her slide, and we'd like to welcome Mary Catherine to share with us about her work.
Thank you so much. I'm very excited to share about Comfort Wave. This is a virtual reality self-hypnosis for chronic pain in the nonprofit. And I'm so excited because I'm someone who suffers with chronic pain. So I'm bringing a framework to this field that I think is unique. Next slide. So what is the problem? Well, women who have mastectomies, when they have the scar, can continue to have pain despite it healing. And this occurs in about 30 to 60% of women. And this pain keeps them from having certain types of clothing and maybe even their breast reconstructed. There are no medications available easily. The studies have not been successful in treating this condition. Opioid use always brings misuse to the table, and there's side effects to the current medications such as fatigue and sleepiness. What we do know is that hypnotherapists can help and pain management can help, but hypnotherapists can charge and it's not covered by insurance, and pain management can be difficult to access. And the truth is, we know hypnosis is a proven treatment for chronic pain. And so bringing a virtual reality component makes it accessible. It empowers the patient, gives them self-agency, limited side effects. It can be done with their pain meds, and we think it can be cost-effective. Next slide. So my team and I have worked for many years together, 20 years, I hate to say how many. Dr. Guy Montgomery works in hypnosis and breast cancer, specifically targeting pain around biopsies. Dr. Dorfman is a psychologist. He works in interventional and behavior. Dr. Simpson is a specialist in neurology. He works with complex pain syndrome. And I've been doing research in chronic pain for 20 years. Next slide. And so we're excited with the next slide to introduce Comfort Wave. As we've developed this product, it's a software that can go into any virtual reality device. We're focusing the Oculus Go right now. We have an FDA exemption for our current study, but we're seeking FDA approval. This experience is just like it sounds, comforting like a wave that surrounds you with images, sound, and narration built on over 200 narratives that we have from our past experience in hypnosis. It's brief, it is very safe, we think, and that's what we're going to show in our upcoming study. We've completed our testing and we're approaching our enrollment in the early part of 2025. Next slide. So who is the market? Well, we're not quite clear because I think a lot of women don't come forward with this pain condition. We know that about 2.3 million women have a diagnosis and that 20 or 30% of these women have a mastectomy. We believe that with a price point of around 250, that the first serviceable obtainable market could be somewhere between 2.5 million to 5 million. Next slide. So who is our competition? Well, this doesn't exist really in self-hypnosis. Comfort Wave is a new type of product. There is a device by Allied VR that offers back pain, but it's along a CBT model. We're seeking FDA approval to be given to patients to use freely with a prescription that can be easily upgraded as we understand more about the types of things people find to help them. Next slide. So our plan right now is we're seeking funding of a 1.25 million in several grants we have submitted. We are pending enrollment in 2025 for our participants. We are seeking to give the FDA, who we've been in discussions with, for the Breakthrough Device Program by the end of 2025, then work towards a multi-site study showing efficacy, secure funding for that in 2026, and then get it into the market quickly in 2027. Next slide. So what are we doing for a business design? Well, it's sustainability because I'm nonprofit. I'm looking about collaborating with a business who is aligned with our understanding of this highly engaged population due to the fact that there are no good treatment options. We believe that we can do this by collaborating with pain medicine, neurologists, surgeons, oncologists, and the patients who suffer. We are the experts and we're seeking for a licensing agreement with a partner who understands what we bring to the table. Next slide. So in summary, chronic pain costs billions. And what we want to do is help our patients who have post-mastectomy pain syndrome have care, have the medical costs that are reduced, that they get back into their lives, that they are not challenged by this suffering, that we want to offer this solution to them first and then to others to reduce pain. We need your help. We want referrals to grant opportunities. We want advisory team members of people who suffer with this condition. We want you to spread the word for our upcoming study in 2025. Next slide. So here's my contact information. I love to hear from patients. I talk to them daily about their chronic pain, and that's what we want to solve with Comfort Wave VR.
Thank you, Mary Catherine. So our first question from our judges is from CJ.
Hi, Mary Catherine. Thanks for a great presentation. I can tell you from a venture perspective and as an internist, we believe that there is such huge unmet need for non-drug solutions for chronic pain. Where we sometimes shy away from investing is because we can't quite understand how you build a successful clinical trial in chronic pain to prove your case. And so I'm wondering how you and your management team, which looks fantastic, have thought that through. What's your path to FDA approval?
Well, we have been in discussions with the FDA. We had a Q submission in the late part of 2023, and they're very clear. They want to see biologics. We don't have the funding right at this moment to add the biological components, such as an EEG, and what we know is heart rate variability that is associated with pain. And we believe that we can give them some very good data once we're able to get the ability to fund that component, which is not cheap, but I think that was their biggest question. How do you know it works? And I think that we are the team that can demonstrate this and bring it to them. I had very intense conversation with them.
Thank you.
Thank you.
Wonderful. And we have time for one more quick question from our judges.
If it's okay, I have a quick follow-up here. Again, great presentation here, Mary Catherine. No doubt about the clinical need to address chronic pain across a lot of different populations. My question is, related to efficacy. I'm also curious about the persistence of pain relief, because I think that's been an area where it's very wishy-washy, and also it affects ability to, prescribe appropriate doses, if you will. So I guess my question is, what early evidence or validation have you done that shows the duration, the persistence of pain relief after each administration of your solution?
Well, we have a past study that shows duration when you're teaching someone self-hypnosis. We do have a study in another pain condition of HIV-associated chronic pain that once we taught it to them, that they would continue to use it and it continued to reduce their pain. But I have a theory that by using virtual reality, following a model found in people who suffer from obsessive eating disorders, that we could modify their pain perception and therefore reduce their awareness of the pain, because we're training them in an immersive kind of disconnecting them from the body of their association to the pain to something different and comforting. So, that's still to be proven. We're still in the early stages, but I believe theoretically that we can definitely get in that door.
Amazing. And Donna, you and I had a small thread on the side. I wondered if you might just also mention the Pivotal Ventures opportunity. I don't think we've discussed that yet today.
Absolutely. So I'm just going to put this link, and everyone should see it in the chat. Essentially, Pivotal Ventures, which is linked to Melinda Gates Foundation, they've made an open global call where there's $250 million available of flexible funding. So this could be private, could be nonprofit kinds of solutions and organizations. Anybody who's trying to solve any solution in women's health whatsoever, I would say apply. And it looks like it's for a $1 to $5 million investment at a time. So strongly encourage that for everybody here who's trying to build an organization.
Thank you so much for highlighting that. I really appreciate that. So now we are on to our pre-seed finalists, and we will first hear from Pinky. So I'd like to welcome you to our stage.
Thank you, Susan. Hi, I'm Dr. Pinky Patel, the CEO and founder of Myri Health. 4 babies are born every second, and with each birth, a mother is born too. Picture this, the dream, a blissful image of motherhood. Society paints a picture that the ultimate dream is forming a happy family. The reality, isolation and lack of support. No one tells you that you'll be operating on just 1 to 2 hours of sleep while navigating extreme highs and lows, all while ensuring another human thrives, often from your own body. It's time to bridge the gap in resources between the dream and the reality. And that's exactly what Myri is here to do. Next. 80% of deaths in pregnancy and postpartum are preventable. The reality for mothers is that their interactions with healthcare are infrequent, often leaving them facing unfavorable health outcomes. 53% of these preventable deaths occur after a mother walks out of the 2 hospital doors. The first and only postpartum visit is at 6 weeks after delivery, and only 40% will make it to this short 11-minute appointment. Next. I'm a mom. I also hold a doctorate, and I'm certified in pre- and postnatal fitness. I had such a challenging experience in maternal and postpartum care that I was compelled to create a solution that would support every mother after me. With over 50,000 in my own online communities, I have directly supported thousands of women in their journeys. This hands-on experience fueled my comprehensive research that I performed to ensure that Myri solutions aligned perfectly with the real struggles faced by mothers. Next. The Myri Health app began as a postpartum tool. It was developed with gynecologists and physical therapists. It offered new moms personalized physical therapy, preventative assessments, expert evidence-based articles, community, which all led to excellent clinical outcomes. But we recognized that to fully support mothers, we needed to start at the beginning of their journey, which is in pregnancy. Next. Now, Myri's intelligent technology predicts and prevents complications. It offers personalized care tailored to each pregnancy. By analyzing real-time data and trends, we can identify high-risk pregnancies, predict potential issues, and offer proactive recommendations to prevent preterm labor. Next. Our platform supports mothers by seamlessly integrating with blood pressure devices, glucose monitors, wearables, and apps to track real-time health data. We prioritize maternal well-being first, but we can also share these insights with healthcare providers to ensure timely interventions and support. Next. So in addition to directly supporting mothers, we recognized that there was a real gap in care that lies between healthcare stakeholders, like a payer, provider, a mother, a doula, community healthcare worker. And to bridge these gaps, we can facilitate care coordination and offer EHR integration when needed. By providing real-time data, increasing touch points, and enhancing the quality of care, we save time and we reduce costs for all the parties involved. Next. For example, our care coordination dashboard delivers real-time health tracking and personalized care plans, bridging patients and providers. This connectivity bridges the gaps in the current system, preventing mothers and babies from falling through the cracks. Next. Our data-driven approach has delivered transformative outcomes and it's improved key health metrics. Next. With over 350,000 users across 44 paying countries and generating 6 figures in revenue organically, our beta success laid that foundation for growth. Our direct-to-consumer experience built a strong brand identity, and it provided invaluable market insights. But to reach more moms, we've refined our business model to B2B, and now we have a robust pipeline. Next. Myri is already trusted by leading brands. We now have a 3-channel tiered process, and we have attracted health plans and public health initiatives. Next. Our multidisciplinary team combines deep healthcare and technology expertise, and we're guided by medical advisors and industry veterans. Next. We are supported by mission-aligned partners and are committed to ensuring the highest standards of data security and privacy, with being SOC 2 by the end of the year. Next. My ask of the HITLAB community is for introductions to additional pilot opportunities and payer partnerships. We're at a very pivotal stage in our business, and we are raising capital to support implementation and drive growth. If you want to check on the health of a community, check on the health of a mom. We are accessible, we are affordable, and we are essential. The world creates tech for the future. It's time we create tech for moms who birth the future. I look forward to meeting all of you in the networking sessions. Thank you.
Thank you, Pinky. That was fantastic. And our first question is from Julianne.
Hi, you packed a lot in there, so there's so much to go for, but I'd love to understand a little bit more about your go-to-market for today and how that's looking and where you're focused.
Yeah, so our go-to-market today, we started with the employer engagement that led to enterprise contracts. So we did start with the self-insured employers that generated that data that I was talking about with clinical outcomes, which was very promising. Now we're at a position where we're in conversations and negotiating contracts with payers and also public health initiatives. So for example, with payers, it is a preventative model. They're looking at us from a few angles. It could be whether they're needing care coordination, or they might just be needing a platform like Myri to improve birthing outcomes. From a public health standpoint, we've done a lot of work in Kansas. We're about to initiate some work in neighboring states. I'm in Oklahoma, in the rural communities. And so we had some promising clinical outcomes with the engagements that we had that were paid with these rural communities. And so with public health, it kind of goes parallel with how these, not just conversations, we're actually now about to implement additional care modeling for some of these communities. So it's primarily payer relationships and also public health. Yes.
Awesome. Thank you.
Great. And another question from our esteemed judges.
Hey, great job, Dr. Patel. Just wondering if you could give us a little bit more insight into your online community of 50,000. I think those are also the users of the platform. Can you cohort them for us? Or if it's not 50,000, whatever the number is, how do they behave on the platform? What do they find most useful? And what is that subpopulation where you're getting the best outcomes that are of interest to those B2B customers that you want?
Yeah, awesome. So the 50,000 was referring to actually my online community. I'm also an influencer. So I started the influencing. Honestly, this is kind of where the idea started organically, was talking about my experience in motherhood. So my background's actually in pharmacy. I worked for United Healthcare for 13 years, but I'm also a pre and postnatal trainer. I authentically shared my experience, which is where the idea came from. So I built a consultancy through social media, and that validated what the pain points were. And so whenever I launched this 3 weeks before delivering my son in beta, don't know if I always recommend that one, but it really garnered the 350,000 users that I mentioned initially. And so that allowed us to understand what did they like, what did they not like, but we're very intentional with data in terms of how are we improving clinical outcomes. So that's how the 50,000 is different, and the 350 is actually the users on the platform. And it started with community. I think there's a lot of value in understanding the end user, whether you sell to a public health entity or a payer, because the end user is still going to be a mom. And so we really got to understand user behavior. And then we were able to now expand into maternal care. And so that has been launched since March. And so we're really understanding what they're utilizing the most. But it's truly, initially it was personalized PT, really understanding that no, we're all not the same when we walk out of the hospital. Every labor and delivery is different. And so that drove improved outcomes. And there's several parts of the app that have had increased engagement even since we've launched in pregnancy. But hopefully that clarified the numbers. Okay, cool.
Thank you, Pinky. Appreciate it. We are now up for our second pre-seed finalist, and I'd like to introduce Ragda, who is joining us from Saudi Arabia today. So we are very excited to hear from you.
Hello, thank you, Susan. I'm Ragda Rashad, co-founder and CEO of Nawara Health. Actually, health education became my passion since I was a teen in the first year of medical school. I've done it in urban and rural settings, and I loved how impactful it is. And then I thought that now being a public health physician with experience in various aspects of women's health, that I will not be struggling to find comprehensive, reliable, and trauma-informed health information for conditions that are outside my scope of practice. But actually, I do struggle a lot. Then when we look at the statistics of limited health literacy among women, whether locally in my country, Egypt, or regionally in the Middle East and North Africa, or even in the US, we find that it's a high percentage with wide range depending on the country, the type of health literacy, and the socio-demographics of the studied sample. The lack of comprehensive, reliable health information is affecting every woman, and I'm not exaggerating. Some info is there, but it's scattered, sometimes conflicting, and often overwhelming. So it's a global challenge, not just in the MENA region, but the language barrier makes it even more difficult in my region. Next. It's a challenge, as we can see, that has many negative consequences, more complications, lower quality of life, inefficient healthcare spending, both out of pocket or insured, inefficient use of consultations, and of course, less self-advocacy. Next. And that's why we're building Nawara Health as an impact-driven digital women's health literacy platform. And by the way, Nawara is derived from the word light in Arabic. It's for girls and women from puberty to menopause and beyond, with a life course approach that's also comprehensive, evidence-based, trauma-informed, and culturally competent. Next. Since the women of reproductive age in MENA are about 107 million, we are targeting to reach 1 million women over 5 to 6 years to improve their quality of life and also optimize healthcare spending per person. Next. Through our work, we intend to achieve these three objectives through AI-powered digital health literacy products as self-paced courses, support groups, and scientific research on our health literacy interventions. We are aiming to cover the various dimensions of health for women, not only sexual and reproductive health. Next. Our business model is hybrid. On the B2C side, it's a pay-per-service model with expected lifetime value to be 6+. On the B2B side, it's going to be through partnerships with institutions so they could provide our products to their members and employees. Next. With our bootstrapping efforts, we have built an MVP of learning management system and developed self-paced courses for maternal and menstrual health so far. Launched 2 support groups. One of them is the first of its kind in MENA. We started in B2C, and that's our main traction through building social media presence and digital marketing, which helped us to get 400+ paid enrollments with ongoing positive feedback and less than 2% refund rate. And also slowly but steadily, we are increasing our growth rate by 30%. Next. What distinguishes us from our competitors is our focus only in health literacy for the various stages and dimensions of health for women, with accessible pricing and also ensuring that we are developing evidence of effectiveness for our interventions. Next. Nawara Health is led and operated only by females so far. Myself and Omnia are co-founders with combined 15+ years of experience in various aspects of women's health, operations, and finances. And our amazing team members have diverse skill sets to help achieve our goals in marketing and R&D, and some of them are attending now. Next. Our focus so far was on building the MVP, optimizing our branding and positioning. some product development, and gaining our early adopters, and also initiating our first study on maternal health courses. Next year, we will be focusing on scientific collaborations for more product development, achieving product market fit, expanding in B2B, and taking some steps in market development in the Gulf area. Next. We've been recognized regionally and globally, and also was an MIT Sol finalist last year. Next. To achieve our mission of empowering women with reliable health information so that they can make informed health choices, we of course need the support of the HITLAB community with their diverse expertise and areas of interest, and would love to know all the possible ways of collaboration. We need training, mentoring, advisors in areas of women's health, digital health, research, AI, and business development. We're currently preparing to be investment ready so we can raise funding in 2025. Next. You will find our contact info in the chat, and we look forward to meeting you later in our breakout room. And thank you for your support for women's health.
Ragda, thank you so much. And our first question will be from Courtney today.
Thanks so much. That's a great overview. My question is really around the why now. So this is a problem which I think has probably persisted for quite some time. I'm curious your take on why can a solution like this get penetration and really start to move the needle on health literacy for women now? Why is this the moment?
Yeah, I think it's for many reasons. One of them is I think the digital literacy and the uptake of digital tools in general is rising, whether globally or in Egypt or in the MENA region. That's for one, even in lower class, not only middle class. And the second is we've seen on social media the huge engagement of the audience with the various healthcare professionals giving health information. It's useful, but also it's very scattered.
Mm-hmm.
So there is need.
Thank you.
We've seen that there is need. Yeah.
Quick question as well. Wonderful presentation. Thank you. I'm curious, when it comes to health literacy, separate from tracking completion, right? How do you actually measure success with competence, right? Increasing understanding of women's health literacy, which I think is different from completion.
Yeah, I think that's an interesting question because most of the studies done on health literacy are mainly focusing on the basic health literacy, or what they say it's the functional health literacy, which is like knowing basic information on nutrition, being able to read prescription or follow medical instruction, but they don't usually tackle the other types like critical health literacy or other types that are more advanced, where women can understand advanced information or criticize health information and make informed decisions based on this information. So that's why we're interested to try to assess the knowledge and attitude and practice, the change in knowledge and attitude and practice through our research on the health literacy interventions, to ensure that it's not just a change in knowledge, it's also a change short term in attitude and long term in practice and clinical outcomes.
Thank you.
Great. We have time for one more question from our judges.
Sure, I can ask one. Thank you so much for a wonderful presentation. Such a big believer in health literacy. Lots in common between Saudi Arabia and even in areas of the United States. So thank you for your great work. I think all of us look for founders who are customer obsessed, and you gave a great answer on the why now and what happens after you complete literacy and what that means for the woman's life. But can you tell us a bit more about how you got to, I think you said 1 million women you could reach over 5 years out of a total base of 107 million. Can you walk us through your thinking and how you got to those numbers?
Yeah, sure. So as we mentioned, that the number of women of reproductive age in the MENA region is 107 million. That's the total addressable market. And we decided that the serviceable, obtainable market is 1% of that 107 million. So it's 1 million. And we thought when we compared ourselves with other EdTech solutions, because their focus is on self-paced courses generally in the region, we found that most of them achieve the 1 million users over 5 or 6 years once they get the appropriate funding. So we made that comparison, yeah.
Wonderful. Well, thank you so much. It was lovely to hear from you. And thanks to such great questions from our judges. We are now to the point of our program where we are going to introduce our last two finalists. We have two seed companies, and I would like to introduce Megan to speak about her company.
Thank you so much for having me today. I'm Megan Doyle, CEO and co-founder of Partum Health. Now, if you're here in this room at the Women's Health Tech Challenge, and we already heard a little bit about maternal health, you are probably well aware of the crisis that we have when it comes to maternal health outcomes in the US. Two specific stats that I want to draw your attention to. The first is this 80%. That is the level that the CDC has labeled as preventable when it comes to maternal deaths and morbidity outcomes. The second on the right-hand side is the long tail of complications that millions of families are experiencing every year as they go through their pregnancy and postpartum. Next slide. The reality is that these outcomes are truly a function of an outdated model of care. Today, we rely on a single OB or midwife without clear integration into the specialists that can really address many of those complications that we mentioned on the previous slide. We also have a very episodic mode of engaging without a way to really keep continuous communication with patients between their visits and while they're outside the home. And a lot of these factors are contributing to a growing shortage of OBs and midwives, as well as increasing levels of burnout. So it's clear from the current state that we truly need to take a new approach when it comes to supporting women and families. Next slide. And this is exactly what we're building here at Partum Health. Our focus is really on addressing the gaps in the maternal care experience. Areas like mental health, nutrition, birth and postpartum doula care, and lactation that today really sit outside of the primary maternity model. And we're delivering that care in a way that really works for modern families. We need to be there how, when, and where they need support. So whether that's in person, when that works best, virtual, so that we can ensure expanded access, and also wrapping that with asynchronous communication and coordination. This is the model that we believe really complements the care that most people are receiving today from their OB or midwife. Next slide. I'm excited to say that since launch and since serving our first 1,000 or so families, we've had incredible feedback from our patients. We've maintained a Net Promoter Score of 95. And I think this quote from one of our patients really captures what it is we've set out to do, which is to provide the type of care that every woman should experience when they're about to have a baby. We're also in the process of collecting both patient-reported and clinician-reported outcomes, and our preliminary data is incredibly exciting, showing that we're able, just as we've seen in many published research studies, we're able to address areas like NICU admissions, NTSV or C-section rates, birth injuries, and also the ability of parents to meet their breastfeeding goals. Next slide. This year, we're on track to generate north of 1.5 million in revenue. That is primarily coming from our direct-to-consumer model. We're live in 3 markets, Chicago, Houston, and Dallas, and providing virtual care statewide across Illinois and Texas. Patients primarily find us either through online marketing, referrals from friends and family, or from physicians. And today we're paid in a fee-for-service model. We have live contracts with Blue Cross, United, Aetna, and Cigna. As we look ahead, we're really excited about the next phase of growth. We plan to continue both our geographic expansion, and we're layering in exciting conversations with B2B partners, both health systems and payers who really want to elevate care for their maternal population. This also opens up the opportunity for us to migrate to more bundled fee and value-based payment arrangements, and excitingly also to serve a Medicaid population. That's been really accelerated by some of the expanding coverage, particularly with doula care in states like Illinois. Next slide. We've today built an incredible team of more than 100 expert providers. So behavioral health providers, for example, who are perinatal mental health certified, physical therapists who specialize in pelvic health, to really bring comprehensive care that's targeted for the pregnant population. Next slide. And we have an incredible team. I myself come from the business side of healthcare. And most importantly, I'm a mom. So it's a lot of those complications I mentioned on the first slide. And my co-founder, Matt Rogers, who's a former colleague from BCG and a twin dad, lived through these experiences as well. We really set out on a mission to change the type of care that families can expect as they start and grow. And we've been joined by incredible clinicians, and in particular, our Chief Medical Officer, Dr. Melissa Dennis, who's an OB-GYN and oversees all of our clinical care and practiced herself for 20 years. We also have an incredible group of investors and advisors who really know how to build and scale health services and health tech businesses, and they've been an incredible asset to us so far. Next slide. We would love to connect, especially with those of you who may be interested in partnering to bring this elevated approach to maternal care to your communities, or investors who may want to meet. We are planning to raise our Series A in 2025. And lastly, we'll be at the networking session, so really excited to hopefully connect with many of you then.
Megan, before I open it up to our judges, we have a question from our keynote speaker. Esther Dyson wanted to know if you could elaborate a little bit about how you interact with doulas.
Yeah, that's a great question. So we actually have a team of doulas. I think we're north of 70 that work with us across the 3 markets that we're live in today. They're all independent contractors with us, so it's a 1099 model. And it covers full spectrum, both birth and postpartum. The other thing I'm excited to share is that we have actually launched our first doula training and certification program. We know that as coverage expands, there is also a growing need to really create and build this workforce up, both by certifying and training new doulas and also providing ways for them to continue learning. So they are truly integrated into the care that we deliver. They chart their births and access things through our EHR. So we view them, even though they're non-clinical providers, as an integral part of our care team.
Wonderful. And from our esteemed judges, a question?
Sure, happy to kick it off. Hi, Megan. Could you talk a little bit further about, first of all, I'm really excited to see the live traction in 3 different markets. Could you tell us a little bit about how you're determining what makes an ideal market to expand into next? What are some of the considerations that go into that process?
Yeah, it's a great question. People always ask why Texas, and I think, first and foremost for us, it's about need, right? We know that there's an incredible shortage of OB-GYNs, and that shortage is increasing, particularly in states where you see more challenging legislation for reproductive care. So that was probably the biggest reason to pursue Texas. We also are building locally based care teams, but we do have to navigate the really fun state-by-state regulations that we have around a lot of our healthcare operations here in the US. And so Texas kind of met those 2 criteria of enabling us to be in a market where there is demonstrated need, a real need to really complement the care that people are getting from their OB or midwife, and also allowed us to reach several population centers within, 1 state border.
Hey, Megan. This is great. Really excited to see your traction. One question I've had looking at companies like this in the past is the provider engagement piece. I think many people want a tool like this to integrate with their OB, maybe even the EHR at the OB. And, I take that there's obviously a difference between connecting people with lactation or doula versus doing sort of remote patient monitoring and blood pressure and things that would be maybe leveled up to a clinician on the OB side. But I'm just curious how you think about OBs in the context of growing this. Are they essential as distribution partners and sort of validation to drive adoption, or are you sort of saying that model just doesn't work, the economics are not there for us, we're just going to lean into more of the D2C and this surround care, which will stay more disconnected?
Yeah, it's a great question. I think definitely the former, in terms of the 2 options you laid out, like we view them as really essential partners. Of course, they're the ones delivering the primary care throughout somebody's pregnancy and postpartum. And we also know what a difficult job they have to try to counsel people on this enormous range of health needs in very short appointment times. So we have from the beginning done, outreach to practices to help them learn more about our services in order to, refer patients and get patients connected when needs arise. That was sort of step one for us. We've also built a lot of our patient experience on a really API forward platform. So the end vision is to continue to, create bridges, both in terms of relationships with the physicians, but also to be able to share patient data back and forth. I would say phase one, has been more about making smart infrastructure choices so that we're able to do that. But part of our focus right now in building these B2B partnerships is understanding, what is the appetite? And, honestly, a lot of OBs are really, really busy. And so they tell you, like, what I want to know is like the patient's getting the care they need, and you can like reach me if you need. But they're not going to be reading updates on, every meeting that somebody has with their doula or their lactation consultant, right? So I think that's definitely something we're focused on in the next phase, is finding the right level of connectivity and communication and integration with that primary maternity care provider.
Yeah, interesting. Thanks.
Wonderful. Well, thank you so much. And we are now going to hear from our last seed finalist. Laura, we welcome you to introduce your company.
Hi, everyone. Thanks so much for the opportunity to be here with you. I'm really so excited about the work that everyone here is putting forward to give women's health the attention it needs. It's a particular passion of mine. I've worked in Silicon Valley for over 30 years. I've been working in healthcare for 8 years. I joined Bone Health Technologies about 4 years ago after selling my last company, which was a software startup to Apple. And when I saw what the company was doing, my first thought was, oh my God, this is such a big problem. And it's a problem that I have. I have osteopenia. And I was very personally familiar with the fact that there are really very limited solutions. And so, that brings me to, I think one of the most, if I get nothing else across, what I want to make sure that I share is that this is an important problem. It's a big problem. Over 60 million Americans have low bone density. This is as common a problem as high cholesterol, high blood pressure, high blood sugar. It's one of the major chronic conditions. But unlike those other conditions, we've made almost no progress. We've, in the last 50 years, had no change in the death rate from hip fractures, minimal change in the rate of fractures. And this is such a huge problem for women. Half of all women will fracture in their lifetime due to low bone density. And those fractures can be deadly and debilitating. The average American woman develops osteopenia in her 50s and then osteoporosis about 10 years later. And while we think a lot about osteoporosis because it's the highest risk, more than half of all fractures happen in women with osteopenia. Next slide, please. And despite the fact that there are so many fractures in osteopenia, until OsteoBoost, there were no FDA-approved treatments for osteopenia. The pharmacological solutions are generally only indicated for osteoporosis, not osteopenia. And they're very poorly adopted due to the serious side effects that exist. And in any event, they're not treatments that can be used. There's no equivalent to a statin that you take early and use indefinitely to improve bone density. And the lifestyle and sort of supplements, so things like calcium and vitamin D, exercise, it's very helpful. It's important to do these things, but they're not enough. And women will continue typically to lose bone density, even if they're doing those lifestyle interventions. Next, please. And so we're really excited to bring this new solution to market. OsteoBoost is based on NASA research and astronauts. Astronauts lose bone density in space. And NASA's proved that you could improve bone density with whole body vibration platforms. But, down on Earth with regular people, it was very difficult to get good compliance, proper utilization, and none of those devices were able to get an FDA approval. So our inventor, who is a physical medicine and pain doctor, had the idea of putting this vibration in a belt, which gives you two important benefits. One is it's easy to wear a belt and incorporate it into your daily living. And second, the vibration is applied directly to the vulnerable anatomy, the hips and lumbar spine. We had excellent results in our clinical trial, which I'll share in a minute. But based on the successful clinical trial, we were able to get an FDA de novo approval. In the history of the FDA, there have been only 16 de novo approvals in the orthopedics world. none for low bone density, and we got a de novo approval. We're also a breakthrough device based on the unmet need. Next slide. We are not just a standalone device. The device is critical and gives you that therapeutic benefit, but we are providing a comprehensive solution of exercise, nutrition, activity monitoring, because doing those lifestyle interventions is necessary as well. It's just they're not sufficient. And there's no one else really providing a comprehensive solution for low bone density, and we're excited to be bringing this to this important market and unmet need. Next slide. So what did we show in the clinical trial? In a gold standard randomized sham-controlled trial, our baseline and 12-month measurements were based on CT scans, so highly accurate, highly objective. We reduced the loss of bone strength and bone density by well over 80% with just outstanding p-values. And so this is really a home run where for the first time we have a non-pharmacological therapy that has been proven to improve bone health. Next slide. Now is the time. Of course, low bone density has been important for a long time, but this is the time where I think we can really make this into a very successful business and bring this to a lot of people. This demographic of women is interested in healthcare. They focus on their health. They're looking for well-researched non-pharmacological solutions. And this has been demonstrated in us having a waiting list of over 10,000 highly engaged patients and caregivers who are interested in our product. Next. And it's not just the patients. We have over 1,000 physicians who've requested prescribing capabilities, and we've been recognized by the top scientific organizations. The American Society of Bone and Mineral Research, the Endocrine Society, have all asked us to present at their conferences. Our clinical trial manuscript is being published or has been accepted for publication in the Journal of Bone and Mineral Research. Next slide. Now, I talked about the tens of millions of patients with low bone density, and we are launching with a self-pay option, but we want to make this available for everyone and not have barriers to care. And so we have prioritized having a strong reimbursement pathway. There are existing codes for Medicare where we can bring this to market using remote therapeutic monitoring. And it's good for the patients. They get a bone health program, and we have strong gross margins for the company doing that. And then we are also applying for HCPCS coverage and DME so that patients can get it standalone. Next slide. Our vision is very bold. We want to solve the problem of bone health for patients everywhere. We're starting with postmenopausal women with osteopenia, the largest group with an unmet need, but we're bringing this to men, to osteoporosis, to other parts of the body, to patients who have low bone density due to other health conditions, as well as a wellness device in the future. Next slide. So I hope you'll join us on this journey. It's an important mission. It's a place where we're sorely lacking in solutions. I think I forgot to mention there are actually no pharmaceutical products in trial right now. So, it's really important that companies that care about women's health are working on this problem. We have an effective solution. It's unique. Patients like it, and I think it's something that we can scale. And we're looking to partner with health systems, menopause and other women's health provider groups, clinicians, and we will be raising a commercialization and scaling round next year. And I will be available in the networking section and look forward to speaking with everyone.
Laura, thank you so much. I believe our first question will be from Courtney.
Hi, Laura. It's really nice to meet you. I know Priya well, who I know you're working with. So it's great to see you here. I wanted to just pick up on something you said at the very end, which is patients love it. You look at it looks a little clunky. I'm imagining what it's like to have something vibrating the base of my spine. Like what feedback did you get during the trials around how it felt and how, what was adherence like? And can you predict, what you think adherence will look like, not in the context of a trial where people are being compensated to kind of stick with it?
Yeah, absolutely. And it's a critical question because this is a chronic condition and people need to want to use it indefinitely. Thank you for mentioning Priya. I did mention the exercise program. Well, that didn't come up by magic. We acquired a wonderful women's health company led by Priya Patel called Wellen, and we've been teaming up and we've integrated that into our solution. But how does the product feel? Most patients say it feels like a massage. So that's the most common description. They say it feels good. It weighs less than 10 pounds, excuse me, less than 5 pounds, and you need to wear it 30 minutes a day. So most patients find it pretty easy to use. Compliance in the trial was over 80%. And we asked them to use it 5 times a week. The average in the trial was over 4. I want to mention that compensation in our trial was minimal. They basically got, transportation expenses and $50 for showing up for visits. So there was really no significant monetary advantage. We had a waiting list of patients who wanted to be in the trial, and I think it just comes back to this unmet need. People are diagnosed with low bone density, and I'll share what happened with me. Between 52 and 57, I lost 13% of my bone density. My lumbar spine. I take calcium. I exercise a lot. And my doctor said, keep exercising, keep taking your calcium. And it's essentially saying, keep doing what doesn't work or what doesn't work well enough. I probably would have lost more without those things. And so women are really motivated. They know what happened to their grandmothers and mothers who ended up, hunched over or frail. And they don't want that to happen to them. So the app, I think, will be very important for compliance. We did see in the trial that there was a dose response. For each additional time per week they used the device, they had a 0.5% better improvement in their bone density. So we really get that, that strong compliance. I don't know if you're a James Clear fan, but he has this concept of habit stacking, right? Where you combine a new habit with an existing positive habit. And so that's what we try to get patients to do. So if they, go walk the dog every day, wear the belt while you walk the dog. And, we've designed it to look kind of like a fanny pack. It even has a similar fabric to that Lululemon crossbody bag. If it's when you can't argue with success, right? If it's when you do the dishes, then that's fine. So we just try to get patients to find something that works for them.
And just, sorry, quick follow-up. Is it a forever thing? Like, this is what you need to do forever? Yeah.
Yes. Just like exercising and
just like
eating
exercise.
healthy,
Yeah, makes sense. Yep.
And by the way, we want people to exercise too, right? But this gives you that added boost to the vulnerable anatomy.
Amazing. Well, thank you so much. And we have finished with our finalist presentations. And thank you to our judges. We're now going to ask you to go off and deliberate. I think it's going to be hard. Amazing hearing from all 6 of these finalists. And thank you so much. So we are now to a part where we are actually going to do our Audience Choice Award. So Jerry and Ainsley, if you could put that up, please, for our audience to be able to vote, I'd be really grateful if you could pull that slide up. And this is the criteria that our 31 screening judges use to pick these finalists. So the voting for the Audience Choice Award should be up on your screen. So please pick your company. And we also want to thank our 31 screening judges. So we're going to pull up a slide with all of their faces on it, and almost all of them are actually here attending. I can see them in our chat. And you will know a lot of them. You're going to know their names because they're some of the most active and supportive angel investors, mentors, and venture capitalists in our community. So every company that applied of the 150 companies throughout the world had at least 3 investors review their application. And we hope that we can create more connections after the challenge is finished. Many of the screening judges and also many of our sponsors and mentors will be hosting networking breakout rooms after we announce our finalists. I see a lot of them here as well. So please, will you announce yourself in the chat and just keep that going. And as a reminder of the rest of our agenda, we have an exciting panel just up on the voice of the enterprise, followed by our keynote and questions with the one and only Esther Dyson, Thank you, Esther, so much for being here. So please start thinking about your questions for her. And we've put all of our finalists back into the audience so they'll have an opportunity to also ask questions. So now we are going to have a conversation that all of our founders have been waiting to hear. And our judges told me that they're hoping to get back early to see this as well because it's applicable to all of their portfolio companies. So what do our payer and provider leaders think about women's health? If our clinicians don't use the technology or don't buy our products, then how do we create the impact that we all want? So Savitha, I will turn it over to you, please, to introduce this exciting group of leaders.
Thank you, Susan. What an absolute pleasure. I was able to catch several of the seed stage pitches, and each one of them is just remarkably, just so much on the money in terms of what's needed. All right. So let me bring on stage, really. I'd love to introduce our Voice of the Enterprise panel here. Today we have with us Clarette Presley from Sutter Health, Ainsley McLean from Kaiser Permanente, Mid-Atlantic, and Sue Merrigan, former Optum, currently at Evergreen Nephrology. So welcome. Delighted to have each of you join us today to represent the voice of the enterprise. And I thought, a good way for us to start would be really for each of you to take a moment, take a minute or two, and just share with the audience what your role is in your current organization and really what your responsibilities are as it comes to some of the topics we've been touching on here. And then we'll get into that during the conversation. So I'll start with you, Clarette. Why don't you please
Hi, good afternoon, everyone. Clarette Presley here, and I am a nurse executive for Sutter Health. I oversee procedural areas and surgical services. My healthcare background started from a very humble beginning. I was a housekeeper, I was a diet clerk, pharmacy tech, transporter, unit assistant. You could probably name all of the job classification in healthcare. I did all of those. And so transitioned to leadership, and I have overseen primary care services, which is really the family practice, pediatric, women's and children. And then now I'm in surgical services that sees pretty much all the multi-surgical subspecialties, in addition to urology, gynecology, all the way to the clinics and bridging some of those gaps as a leader. Thank you.
Thank you, Clarette. Awesome. Ainsley, why don't you please introduce yourself?
So much, Savitha. Thanks, Clarette. I'm Ainsley McLean. I'm a radiologist, practicing neuroradiologist by training, and I'm the Chief AI Officer at Kaiser Permanente within our Washington, D.C. region. So I have a deep fondness for all things technology and all things healthcare. And within Kaiser Permanente, I have a few other roles. I serve on our National Products Committee, where we negotiate for all of our large equipment nationally at an enterprise level. And I also serve on Kaiser Permanente Ventures, helping to kind of figure out what companies that we feel can really help promote the Kaiser Permanente mission of value-based care. So thank you so much. Looking forward to the conversation, Savitha.
Yeah, amazing. Thank you, Ainsley. And Sue, last but not least, I mean, truly, data is the backbone. It's the critical enabler for all things that we're talking about today. Why don't you please introduce yourself?
Thank you, Savitha. So I'm Sue Merrigan, and I'm the VP of Data and Interoperability here at Evergreen Nephrology. It's a startup. We partner with nephrology groups across the United States, and we do joint ventures with them, and we help them care for the chronically ill patients that have chronic kidney disease. My background is all data. My whole career, I've been in every industry other than finance, I think. I got into healthcare when I did a stint at Children's Hospital back in 2015 and stuck with it because I found the data so interesting and challenging that I never left. So here I am in, now a healthcare startup. So it's exciting.
Awesome. Thank you, Sue. So I wanted to maybe just frame today's conversation with a couple of facts, right? To lay out a couple of the market forces as it pertains to women's health. I think earlier in the day, we've all heard enough about how women's health is really an underfunded category when we look at digital health investments from the VC community. And just for reference, I've been tracking this space for almost 15 years now. And we can, it's even today, it's anywhere between 2% and a quarter to maybe 8 or 10%, right? But regardless, the point is less than 10% of all venture capital investments in digital health are, going into this category of women's health. I wanted to add one more fact. I don't know how many of us have kind of followed this, but just about a year ago, this category has really, started to reach, awareness at a level that I think we're finally going to see some shifts in the market. Just last year, President Biden had announced the first ever White House initiative on women's health research. And earlier this year, I'm particularly excited about the National Science Foundation's call for proposals, where they specifically were seeking proposals that looked at, research and engineering criteria, conditions that study how uniquely, differentially, or disproportionately the set of diseases that affect women's health, right? So I think the market is shifting. So with that, we really want to hear, and to our panelists here, I think as you all know, we have in the audience a mix of startup founders, investors, and other ecosystem participants in women's health. So I think the first question I'd like to just get everyone's perspective on is, in your respective roles, each of you has, in some shape or form, an innovation strategy or mission. You're charged, you're in your leadership roles, you have a strategy where in some shape or form, you're tracking where the innovation is happening, you're scouting the environment, you're figuring out what's out there, and you're trying to find ways to bring them into the enterprise. So how do you think about innovation overall in terms of how you execute on your strategy? And specifically when it pertains to women's health, right? And by the way, no answer is a bad answer, right? If the answer is, you know what, we've not even thought of women's health as a category. When I think of a big new initiative in my organization, that's perfectly fine. I think that's really what we want to understand a little bit better here. So does anybody want to go first?
I'm happy to go first.
Please.
Sure, Savita, thank you. So, our focus is really on getting that 360 view of a patient, whether that be a woman or a man. Unfortunately, the hard truth is we don't focus just on women. We really focus on people with kidney disease, but it's very applicable. So getting all the possible data that we can get on a patient is really our focus to be able to fulfill our strategy of having them live healthier lives and keeping them from progressing to a later state. So we go with the qualified health information networks to get data. We go to all our joint ventures. We're getting all the EMR data. We got the payers. We're getting all the payer data, health information exchanges to get admit discharge transfer data. So really our focus and strategy is let's get every piece of information we can on that patient. So we have all of the data elements that we need to be able to do analysis and improve their health.
Yeah, and that's foundational. Thank you. So let's come back to that in a moment after getting everyone's perspective. Ainsley, how do you think about women's health or in the context of your innovation strategy?
The statistics you gave, Savitha, are sobering, and I do think they're improving slightly. I think it really starts in the C-suite and at senior leadership levels, and needing women who are positioned there, who are thinking strategically about, all aspects of company performance, but can shine that really important spotlight on women's health. At the Mid-Atlantic Permanente Medical Group within Kaiser Permanente, we have 60% of our senior leaders are women. And I think it really does make a difference. And I know for me, when I'm looking within the innovative pillars, I'm always kind of keeping that vertical of women's health first and foremost. So I'll just give a small example. Breast cancer, for instance, screening mammography, and that's what Kaiser Permanente does best, really, is this value-based, evidence-based care. And if we have women living longer, healthier lives from breast cancer, which we do, we know women are the backbone of almost every family when it comes to healthcare decisions. So if we can keep women healthy, we can keep women happy and live long lives, the reality is everyone benefits from that. So I think that the most important thing is having conversations like this, but also having conversations like this when you're setting out, as you said, your operational goals and your operational plans for the year. And I think one of the things you and I talked about, I mentioned breast cancer, but of course, women's health, as Sue alluded to, is really across the spectrum of every disease. So I don't see it as a limiting factor. I see it as something where, every disease honestly seems to affect women pretty differently than it does men. It's oftentimes more common in women than it is in men for certain diseases. And then obviously there's some like reproductive health that affect only women. So I think it's important that we don't narrow down our strategy, but just make sure that we're shining a light through our research and innovation. And I'm really proud that Kaiser Permanente does do that.
Yeah, absolutely. Thank you, Ainsley. And we'll come back to that. I had a follow-up question, but let's go to you, Clarette. I mean, first off, I want to remind the audience, I think we're really fortunate to have you represent kind of the nursing leadership voice here for this discussion, because so often than not, in my experience over the last 10 years, we just don't have that voice represented at the table. So would love to hear from you, in your role at Sutter Health, how are you thinking about, your innovation initiatives, and does women's health, factor in that concern?
Yeah, I mean, I will piggyback with Ainsley here, right? It start with leadership. With us, we just recently have a new CEO. He's 2 years in, but I will say the transformational pieces of this organization has been in an accelerated. Warner Thomas, he's our CEO, and he has been really focused on rebranding and refresh mission vision. And so for us, there is that huge impetus from our leadership setting the expectation on where we as an organization are headed to. The biggest expectation, the question, are you all in? And these are the set expectations for us. And so we're doing it authentically. We are being inclusive. We're looking at every single angle of any and every, especially women's health. There's a huge advocacy. And as far as nurse executive, we also see it from, the patient's voice. We look at it from our workforce. Specifically for us right now, I work in surgical services. When we go into the landscape of our care, we're looking at, do we have providers within GYN, oncology, surgical, subspecialties? What does that look like? Do we have a backlog? If we have a backlog, what can we do to do due diligence on physician recruitment, preserving some of our physicians who are really embedded in innovation, such as robotic surgery? My oversight as well is in robotic surgery as within the system. And so there is a voice. I'm one of those biggest voice, and many of us are advocating for women's health. It's non-negotiable. So that's one of the biggest thing that I will say Sutter Health is doing. We're looking at preventative measure. We're looking at being inclusive. We're looking at our service population to make sure, one, we're serving our patients, but also what does our workforce looks like? We wanted to make sure that there is a reflection of our workforce as well and preserving them.
Awesome. Thank you, Clarette. I think that's incredible. So I think we've established a few things here. If I kind of summarize what I heard from each of you, really at a higher level, it comes from the leadership. These messages, these strategic imperatives are laid out at the top. So you've all kind of underscored the importance of having a strategy that's endorsed by the leadership, that you have lots of conversation and advocacy in the organization. That's amazing. That's fantastic. Let me go to the other extreme here, and I'm going to kind of follow up on something that you said, Sue, and I've been in those shoes, and so I totally relate to what you're saying. right, from your perspective, where you're at as kind of head of data at Evergreen and in your prior role at Optum, what you focus on is let's make sure to capture all elements of the data from this, patient's longitudinal view, or, we have different, names for that. But the point being, you're coming at it from, I don't want to say bottom up, but I'm going to say that, right? You're saying first order of business is let me capture everything that I need to or can capture, and then I'll figure out what to do, right? So just curious, I mean, look at all the founders, incredible startups we saw at the Pitch Fest just now, right? How do you see, Sue and the others, your organizations, are you leveraging those data elements? Is there awareness that we need to slice and dice and look at this information, this data, from a women's health perspective? Or does that get subsumed in the specialty? How are you leveraging the data to actually, accelerate the progress in women's health, if you will? So I'm going to ask that of you.
Yeah, both at Optum and here at Evergreen, we're not doing it from that women's perspective, but there is not any reason whatsoever why we could not, right? So if we wanted to look at everything that is based just on women's health, we could easily do that. And it's just not an initiative. For Evergreen, it really is about their kidney disease and their progression and keeping them from progressing and doing the best possible care plans that we can for them. So that's why the data is so fundamental for us. We need to know, did they hit the hospital? Did they go to their dialysis? What are their social determinants of health? Do they have food insecurity? It just goes on, right? There's so many pieces of information. And I wouldn't say that we collect all the information and then start using it. Really what we've done is we focused on piloting, rolling out, getting additional information, adding into those, those data sets into our analytics and our predictive analytics. So because collecting data, as you know, takes a long time.
Yeah. No, and thank you for sharing that perspective. And I think you and I chatted about this earlier as well. But Ainsley, I'm curious, right, from a Kaiser Permanente, for the scale and the reach that you have in your role, are there ways by which some of this data in the health record or other sources, is that being leveraged? Is that being considered as you think about, your end goal, which is really improved outcomes for your patients?
Absolutely. We're a very data-driven organization. I would say there's almost no decisions that are made without data. And we certainly, don't have a paucity of it. And I would say it would be very rare for us when we're looking at a specific disease not to break it down by, every segment that we can. And a lot of that goes back to just our focus on population health, but then also our focus on personalized health and social determinants of health. So recognizing that, the house you live in, the city you grow up in, and where you live is going to influence the way you respond, the way as a care delivery, we have to make sure we reach out to you and capture that. I think it also helps inform decisions that you make, right, around implementation of new initiatives. So do we need to do a research project to dig a little bit deeper? I know you'd mentioned earlier, Savitha, about innovation. And as we're looking at new innovations, particularly in the AI space or working with startups, one of the first things that I always kind of do is look at, well, how has this particular product been tested before? What population has it been applied to? So for instance, if we're looking at an AI algorithm, was it only tested, say, in a Northern European patient population, maybe because it's related to skin cancer? And then do we then need to make sure that we're shining that light, that diverse light? So women of color, women, period. And just, I think more and more with healthcare, we're realizing that we have to take it down to that individual level because disease is really incredibly personal. So we always remain data driven in everything we do. And I think the other last piece I'll kind of close that question with is around our quality and our HEDIS metrics, which we're a national leader in that specific space. And so when you're looking at populations like how you treat diabetes, I think it just gives you that extra level of granularity. And then you know what interventions we can do. For instance, maybe there's a new technology, some of which, maybe on this call that specifically is beneficial in women. But if we don't know we have a problem to begin with, how are we going to know that we have a solution to it?
So thank you for that. And I just have to share this one tidbit here. That's kind of, I think, really amazing. I think you're at the forefront of really considering for each of the, whether it's the specialty or whatever the case might be, considering the women's health aspect of it. How does it, how does it affect these specific populations? But I was just looking at how recent has femtech and kind of women's health, kind of come to mainstream, if you will, if we are willing to say that. Not until 2016. I know this is a strange example, but just female lab rats, female mice were mandated to be in NIH's research only in 2016. So look at where we are. It's this is in 10, until 10 years ago, even in the lab, even in the engineering space, our population samples were not representative. Right.
Menstruation definitely interferes with scientific studies. I was actually out to dinner with a colleague in Southern California who works at a large research university out there, and they had just finished doing sort of the protocol for a trial. And she said, once again, it was all male laboratory rats because of menstruation and because theoretically the hormonal cycle, so I always think of that with everything I eat, every medication I take. I'm like, wow, the influence of the hormonal cycle has not been studied, whatever this is. And I think we all know how we feel different every week of the month, and after that ends as well with menopause and beyond. So a lot more work needs to be done.
Totally. Clarette, I'd love to hear from you. I really learned something, eye-opening from you the other day about kind of how the surgical service line operates, right? The peri-op and post-op and so on. Would love to get your perspective from your surgical service line perspective, or broader, how you think about when you're looking at your innovation strategies, right? And the data associated with, are you considering women's health? How is that reflecting in your kind of day-to-day role?
Well, I'm going to answer it in two ways. There is a piece in which how are we tackling innovation, and then piggybacking on the women's health, right? But we are in healthcare, we are in hospitals, and as you know, hospitals, especially in the operating room, we live in those red lines, and we have so much sacred cow. We are probably the last person to try to, get socialized with some of these innovation. But at the same time, it's ironic because surgical services has one of the most, high-tech equipment, right? You talk about robot, you talk about C-arm, all of the different aspect of it, including AI. The influence piece is tremendous. So for us as leaders, for us who has credibility that came from the very humble beginning, it's very critical for us to partner with vendors, especially with people that are plugging in the innovation and technology, to make sure that we are embedding the end users. So we need to make sure that there is an influence phase in there, that my team have a growth mindset, and that we are welcoming the innovation piece, because that's the piece that is very critical as far as trying some new items, new equipment, new supplies, and whatnot. One of the things that you and I talked about recently is one patient will have at least 50 to 70 touch point from the time that they call for an appointment or they book their appointment, a human touch point. From going to their primary care providers, getting to an e-consult, going into their subspecialties for surgery, all the way to my team and going back home. That's 50 to 70. That is so ridiculous and redundant, right? We call you 72 hours. So those are probably, I would say, patient-centered care. Those are the things that we are trying to solve to ensure we do use automation when they need to be used, and then we do the patient-centered care in which it's personalized to make sure that each patient is valued and respected that way as well. So as far as some of the KPIs and using some of those data, it's imperative for us in our organization to share those data so we can be more objective. Many times we're very, anecdotal, and that is not acceptable anymore. We need to make sure, we have the numbers, we have the data, we also have the actual action items that we are trying to implement.
Yeah, thank you. Thank you, Clarette. So, it all comes back to the data, right? The data we're collecting, the data we're slicing and dicing against for the outcomes that we're all looking to drive. Now, I know we are planning to kind of head out into the networking, but I'd like to kind of frame one other question and really ask each of you to share boldly, what your thoughts are. Again, you're all in, leadership positions in your organizations, and for our audience and panel here, what are some of the gaps, right, or shortcomings in the current, technology offering landscape as it pertains to women's health? And maybe we can, make it broader than that. Because, for example, I know, Ainsley, you're in that business of constantly vetting the landscape, looking at what's out there to serve the populations you serve and drive the outcomes. Clarette, you do that from the surgical service line. Sue, you do that from kidney care perspective, right? So what would you like to leave our audience with, in terms of thinking as they, if you could share what you see as major gaps in terms of offerings that the market offers to support your strategies to drive improved outcomes, right, for our patients. Again, let's start with you, Sue. What are your thoughts on that?
All right. So for me, it's really around AI for correlating and summarizing data. So we have so much data out there, it's so vast. And if I think about our healthcare providers and they have limited time to really zero in on the patient because they're boom, 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 one patient after another. And if we had AI where we could take all of these correlation factors, right, correlate the data, bring in the factors, summarize that, put it in front of the provider when they come in to see the patient so that they can make really quick, sound decisions. Something might take months, but if they have the, AI correlation of those factors and having that information summarized before them, it could, be instant for them to see a pattern or recognize, an issue that they could address very quickly.
Thank you. I love it. I'm hearing that all the time in my conversations with various enterprises. So AI correlation, theme number one. How about you, Ainsley? What's top of mind for you?
I'm almost like, where to begin? There's so many opportunities. And I think, one of the things I think about in just thinking of the female experience, and a lot of it is around putting yourself in your own shoes. And if you could write healthcare, what would it look like? For instance, for us, a lot of it is, how can we bring healthcare to you wherever you are, through a virtual visit, through something that's automated where you're on the run and you could get, consume some information about menopause or about your child's conjunctivitis. So kind of, building out this algorithm for how do we meet women where they are. And the reality is women are extremely busy and wear a lot of hats. So I'll give you guys just one more example, Savitha, is we provide instant screening mammogram results. And that came out of our radiologists just realizing that women can't wait more than like 60 minutes and wonder whether they have breast cancer. They have so much going on. So I think sky's the limit. I love the focus on the pregnancy journey and beyond. I think that there's so many opportunities there. We provide remote patient monitoring in that space, but I think it's really an understudied space. But I think there's just so many opportunities around the woman lens and that female experience, how you want to consume healthcare. And I think that chapter is still yet to be written. And I don't have the answers. So I'm hoping everyone on the call does.
All right. Closing thoughts, Clarette. I think any one theme that you want to leave with the audience?
I I would say a lot on patient access, right? With one, if I can, I mean, if we as women could think of an open table version of how to really streamline bookings for appointments for women, in which working women, and that's not a Monday to Friday type of schedule. We need to be able to cater to working women. I mean, we might have to create some sort of brunch type of scheduling availability, but for me, a more accessible appointment settings in which it is catered for women. So that's one thing. And then the other piece is really having embedded accessibility into some of the unconventional locations. Spa, you can go to, some of the lounges. That is really accessible.
Wherever you are, as Ainsley said.
Wherever you are. I mean, you can hit the Eiffel Tower and you walk that way, and there's, a couple of places to get some quick mammo or quick, whatever it need be, right? So I think that's it's access in some unconventional places that, hospital and clinics are no longer trending.
Yeah, very good. I want to thank our esteemed panelists here for your thoughts. Really appreciate the opportunity. And back to you, Susan.
To Ainsley, Clarette, and Savitha, thank you for so much for all you do. And this conversation was truly inspiring for our founders and community. What a powerhouse panel. Thank you. So it's a great privilege to have Esther Dyson with us today as our keynote speaker. And it's really an honor to be able to introduce her to this community. About 10 years ago, I joined Hillary Hatch to build a company called VitalScore. Esther was our first investor, our first check, and it changed everything about the company. Words will never describe my gratitude and the impact that she had on me as a founder, as well as an investor. And everyone that knows her shares that sentiment. She is one of a kind. As a renowned entrepreneur with a forward-thinking mindset, investor, author, visionary in technology and healthcare, Esther has paved the way for innovation and collaboration in health, AI, education, policy, space exploration, and global well-being. She challenges conventional approaches through her efforts to shift focus from treating illness to fostering resilience. And her dedication to promoting long-term health outcomes through Wellville is truly inspiring, and it gives us all hope for the future of health. So she's agreed to give a few prompts, as she will call it, share a bit about herself, and maybe she'll even tell us about these incredible astronaut photos. And then she's going to take live Q&A from our audience, so please add your questions to the Q&A section. Beyond her many accomplishments, she's also a mentor and an advocate for female founders, constantly championing the next generation of women innovators. So thank you, Esther, so much for being here. And it means the world to all of us to hear from you.
Thank you. After that intro, I think I should just be quiet. So good afternoon, good morning, everybody. And I will tell you just a little bit of background, and then I'd much rather answer your questions, because answering questions is more interesting than repeating a speech you've written for so many people already. In a sense, I need to do not a land acknowledgement, but a luck acknowledgement. I grew up very privileged. My father worked for Oppenheimer. I knew Nobel Prize winners and stuff like that, but I knew very little about the real world. And sort of following in the footsteps of science, I started asking questions. I went to live in England the year I was 13. And among other things there, I spent a fair amount of time with my aunt, who used to work for the National Health Service in England. She was what they called an almoner. It was essentially a doula, and her specialty was unmarried moms. And probably the way they would describe those unmarried moms at that time would be shameless hussies. And her job was to guide them, kind of like some of the companies we heard this afternoon, to deal with a society that rejected them, to try and be healthy for their babies, to try and get through the birthing process, maybe reconcile with their families, or find some way to survive in a world that was pretty hostile. So that piece of my life lives with me for many reasons. And when she died in the early 2000s, a bunch of the kids whose births she had assisted at showed up at her funeral. And that whole transition of generations and so forth is in some sense what I'm still working on. So a few other things, and then please just ask questions about what interests you. Wellville started as a 5-year, 5-community, 5-metrics contest. And I was going to get funding for it. As I said, I've been extremely lucky. I made a huge amount of money in the stock market just by being lucky. I also, you could say I was unlucky. I was, as you noticed, on the board of 23andMe, and financially that didn't work out so well, but it was an amazing education. I learned a lot about genetics. The space training, I learned a lot about space travel. And again, you need to be lucky to be able to do this, but my motto is never take a job you wouldn't do for free, but then try and get paid. And by being able to follow that, I've had an amazing life and learned a ton, and I'm still doing stuff. So Wellville, I was going to go out and raise money for that, but it was too weird because we weren't focused on medical care. The way it started was that there's this company called Real Age. I can't really see a show of hands, but its business model is selling vitamin supplements. It asks you about your social determinants of health in a sort of polite way. Do you live with a partner? Do you have pets? Do you eat well? It doesn't go into the tougher social determinants of health like poverty and racism and parents who were addicted or absent. I will say I'm a childless cat lady, but without a cat, but I care a lot more about parentless children in whatever sense that might be. Anyway, Charlie Silver, who ran Real Age, eventually sold it to Hearst, who sold it to ShareCare. But what was interesting was who he sold his first company to. And that was Jiffy Lube. Oil changes, as in maintenance. And it occurred to me, maintenance. We should maintain human beings better because so much of healthcare is just a repair job for things that shouldn't have happened. And so much of what we were hearing about today is about keeping people healthy, whether it's babies or bones, rather than fixing things that went wrong. And that in a sense was the purpose behind Wellville. As I mentioned, it was too weird to be funded. We weren't going to hand out money. We weren't going to come in with a program or a playbook. We were going to basically be counselors and advisors to 5 communities that wanted to become more healthy places for people to prosper. And so the first thing I learned was 5 years is not long enough to earn people's trust. So it ended up being 10 years. It's ending at the end of this year. The 5 communities didn't want to compete. They wanted to collaborate and learn from one another. So it was not a contest. We couldn't raise the money for a prize. And ultimately, the metrics are useful, and we are collecting some data, but what we were really trying to build was less a clinical trial of some precisely defined intervention, but more to help 5 communities fulfill their own desires, use their own intrinsic motivation. We learned quickly telling people what to do if they're not fundamentally interested in doing it it's not the right way to either raise children or help a community come together. So that's probably enough for prompts. One more at the end of this, my next challenge is going to be to write a book not about Wellville per se, because that's kind of like writing a book about marriage by writing about your own marriage. There's just too much detail, too much personality. It's more, what did I learn, with some anecdotes that could be applied more generally. And second, as I mentioned, Wellville is unsustainable. I love what we were doing. I think it was very helpful, but you're not going to find a lot of lucky people like me funding this kind of thing all over the place. And ultimately, we need collective investment, not spending, on the health and well-being of our future generations. So I'm going to let you do the questions, Susan.
Esther, there are a lot of questions. I'm going to just so people know, because I see many of them, I'm going to do the first question from Anne Klein, followed by Avonlea Christine, and then Chris Brown. So the first one from Anne Klein is addiction is a huge issue in many U.S. communities, destroying families, and it seems to be unstoppable. So what have you learned from Wellville or elsewhere? What can we do differently, and how do we address this?
I love this question. I mean, I hate the thing, but something like hate the sin, love the sinner. I first learned about addiction well before Wellville, and in fact, starting pretty much in Russia, which I was visiting. I learned Russian in high school for a bunch of reasons and started going there in 1989, and I saw the impact of despair and a sense of uselessness, a sense of powerlessness, and the rampant alcoholism. I talked to one of my friends, about smoking and drinking so much, and he said, "Well, Esther, we don't like the life so much, we want to live so long." And in a sense, I would call addiction negligent suicide. But what I also learned about it over the years, and also in Wellville, is addiction. So ironically, I know some of you are interested in my investments. I have 2 couples counseling companies. One is about you and your food, and the other is about you and your money. Addiction is about a toxic relationship with something. It could be a substance, and there's physical dependency, but addiction itself is more this craving for relief from something, whether it's gambling or a drug or food, or for some people shopping, and it kind of takes over your mind, and it shortens both your vision going backwards and forwards. You've probably alienated your family. You really have you're so focused on relieving that addiction, you aren't really thinking about your future, and it's not good for you, but you do it anyway because you need it now. And you also know you should behave better, or your family's going to abandon you, you're going to lose your job. And somehow that relief isn't coming, but you're just caught in this. And it's not just about poor people in poor communities. It's also community organizations addicted to short-term grants. And again, they have no vision for the future. We need the money now to pay our part-time coordinator. And whatever these guys want us to do, we'll do it for a year. And, then they'll either say it's successful, so they're going to do something more innovative, or they'll say it wasn't successful, so they're not going to fund us anymore. And venture capitalists get addicted not to sustainable companies, which I hope is what you all are building, but to exits. And politicians, of course, get addicted to votes and to staying in office and to being surrounded by people who tell them how great they are. And then there are longevity billionaires who, even though they think that they want to live forever, right now they're addicted to sort of almost punishing themselves and not even enjoying their lives by chasing this dream of, I got to last forever. And so addiction, what do you do about it? I mean, there's lots of useful things you can do with short-term treatments, but fundamentally they're trying to give people back their sense of purpose and of human connection. the thing human beings most need is to be needed by other humans. And if you look at the movie Her, which got a lot of press recently, courtesy of Sam Altman and OpenAI, the problem with that love affair between Spike Jones, I think, and his girlfriend, played by Scarlett Johansson's voice, he discovered that she had 1,500 lovers and didn't need him. Even though she could pay as much attention to him as he wanted in terms of time, he didn't get the percentage, and he knew she was fine without him. People need that sense of purpose, of mattering. It's the difference between an influencer's audience, which they count in numbers, and the members of your family, who are each unique individuals that care about you. It's not quite that simple, obviously, but that's what I've learned about addiction.
That's amazing. I hope you see all of the emojis and the love going on. People are just really so grateful to hear your words. We have a question from Avonlea Christine, who is the CEO of Avonlea Care, and I know you're the chair of her company. I have the privilege of being an investor alongside you. She'd like to ask about how important is securing the future of the care economy, especially when it comes to our aging population, and how do you see unpaid caregivers evolving? What strategies could health plans adapt to better support our unpaid care workers?
Okay, so first I'll talk about the meta, and then I'll talk just a bit about sort of the business. So the meta is everybody's fussing about training our AIs. We got to train them to do this and that and the other, and we do. And the great thing about them is they're very scalable once you train them. And there's lots of issues around embedding bias into the AIs because they basically copy human beings. There's a lot of issues around unexplainable AIs. And honestly, I think unexplainable humans are an even worse problem. And so the solution to this is training our babies, not training them to do things AIs can do, but training them to be better humans, to have that ability to connect that I talked about. That's the opposite of addiction. To think long term, to care, to notice, to have empathy, and to need one another. And this is what we kind of lost in so many ways in schools. I mean, it's not just home ec, but sort of the civic and social parts of school, not just the arithmetic and the writing and reading and your history lessons. It's training a workforce. When you come into a company, interns do a lot of work that can be done by AIs, but the most important work they do is being part of the business, learning from their bosses, communicating with their peers, and having that human creativity and so forth and so on. And now we have a society where people are getting disconnected and it's fragmented, and we need more people to do that human work, whether it's paid or unpaid, of being there for one another, being family, but also being neighbors, showing up at the PTA, being human to other humans, and socializing and so forth. So that's the bigger problem in a sense. And then there's the problem of so many families that are fractured. We do now have children whose parents are missing or themselves have not, quote, being trained to be good parents. And this is not training out of a book. It's being trained by human beings. And it's lonely elders who are disconnected from their communities and who often don't live with their kids. And Avonlea Care's model is primarily focused on it's such a huge market and there's a lot of companies in it. We have a very specific but large focus, which is the kids of remote parents who need support, who are probably on Medicare or Medicare Advantage. They need appointments scheduled. They need food ordered from Walmart, which is something you can do specifically through Avonlea Care. They need remote monitoring of various kinds. They need to be reminded to take their meds. They need to get their visits to the doctor not just scheduled, but call the Uber or the local taxi or whatever the local arrangement is for getting people to doctors and so forth and so on. And meanwhile, these caregivers are themselves not being cared for. I remember talking to the wife of it's long and complicated, but the wife of a man who subsequently died. And she said, my kids come home and they ask, how's dad? And they never ask, how am I? And, dad has me to love him, but what about me? And she feels guilty for asking that. And at the same time, she desperately needs some care herself. And we try to support both sort of the tangible, arrange the appointments with the doctor, and the intangible, have a community around you, help you connect with your family. So, okay, I've been talking to mom all week. It's time for my little brother to call her, or it's time for my little brother to drive over from the next town and help her fix her washing machine, or, whatever it is. But somehow providing a support network, just as we were talking about in mothers need support, all kinds of people need peer-to-peer support, and adding in, again, that sense that you are not alone. Not only do you have a purpose, you have people who need you, but you also have people who will assist you, because the work you're doing is so important. And from Medicare Advantage's point of view, an unpaid caregiver that loves the patient, I mean, what a deal. Support them up the wazoo. And that's basically what we're talking about.
That's amazing. I'm going to shift gears a little bit. Chris Brown asked a question about if you could describe any serious challenges you've had with some of your portfolio companies, and how the character of the personnel involved played a role.
I mean, the serious challenges are mostly people who go off the reservation one way or another. And just like what I said earlier about Wellville, I'm not going to name any names, but everything from people who get into fights, whether it's out in the world or a founding team that ends up not working together well. So I'll tell you a story of my own. This is, I had a newsletter and a conference about tech for 25 years, and this was a few years in. And as I said, the purpose of this company wasn't really to make anybody rich. It was my own education, plus, helping the industry develop. So it was small, and we weren't going for growth. We were like 5 or 6 people, and I had dropped my computer in Russia, and its disk drive had been damaged, and I brought it back home and asked one of the team, could you take it and get it repaired? And after 3 days, my CEO, because I also believe being CEO actually is not the best job. Being the person who does all the fun stuff and having the CEO run the company I was very happy doing that, but I owned the company. So after about 3 days, the CEO comes in. She's still a friend. And she said, Esther, this is kind of awkward, but we really are trying to get your computer fixed. And you seem to think that, we don't care or something. I mean, just be nicer. And I was shocked because I know for a fact I didn't say you're stupid or anything like that to anybody, but clearly I was grumpy and complaining and, and I realized, oh my God, number one, I've been behaving really badly. And 2, she's terrified of telling me that. And it's like 5 people. It wasn't as if I was Elon Musk handing out $1 million bonuses or anything. I've always remembered that and tried to look for people who wanted to hear the truth rather than, always wanted to be CEO. So there's the best kind of investor wants to solve a problem. It's not, I have the solution, because then they're clinging to the solution. Most companies start out with some notion of a solution, and 3 years later, they've pivoted, they've changed it, they've brought in a new design team or something. But the ability to change and to focus on the mission rather than, I know I'm right and we're just going to do this, is extremely important. I'm trying to think of other bad mistakes, or, but it's so much about character and mission, because the problems and the solutions, people can copy them. What they can't copy is a dedicated team that will then move beyond where they were, as opposed to the copiers who just keep copying somebody who figured it out first.
Wonderful. Well, we have time for one more question. And Esther, there are a lot of questions for our audience that we haven't been able to get to you. So Jerry and Ainsley, if you can help me record these just to send them over to Esther.
And send them to me. I'd be happy to be helpful afterwards.
You're amazing. So we have a question that kind of it piggybacks a little bit on what we were just talking about, because I think a lot of what we've talked about today is the unmet need. And I think a lot of our founders are looking for investment. So what are the 3 key elements that an investor looks for when considering supporting a startup?
Okay. So first, there's a big difference between angel investors and investors who invest other people's money. So as an angel investor, I don't need to apologize for losing people's money. I might need to acknowledge my own carelessness or something like that, but I can afford to take risks that a professional investor just doesn't want to. And so I can take risks on people, I can take risks on things. I mean, some companies are sort of like, well, would I fund this if it was a charity? In that case, and it's a for-profit, so it might even be self-sustaining, even better. But if you're investing other people's money, you can't really do that. But it's sort of more, and I always focus on again, people differ, but I'm looking for something that's useful and ideally not redundant. Because if someone's doing it already, bless them, and they should do it better, or I should fund that company or something. I'm looking for things that I think are fundamentally honest business models. What they say in Britain is it does what it says on the tin, and that are straightforward about what they're trying to do. They're not kind of some devious business model or other, which is one reason I like health more than health care. Again, the creation of healthy people, babies, elder people, versus, oh yeah, we'll do the repair job, but we sort of have an interest in a lot of people needing to be fixed. I want to give people the resilience to not need most of healthcare. And believe me, there's no problem. Healthcare will continue because it is needed. But the way to reduce healthcare costs is to reduce the need for healthcare, not to stiff doctors and underpaid nurses and doulas and so forth.
Well, thank you so much, Esther. We're going to be presenting our awards in a minute or two, and I want to invite all of our finalists and the sponsors to start coming to the stage. And I wonder if you have any closing words for us. It's been just such an honor to have you here. Thank you so much.
Closing words. I should have thought of that one. Don't be scared. Do what you believe in. A lot of people are scared of, there are things they're scared of that don't want to think about. Think about them and ask yourself, well, how bad is that? Will I still be alive? Will I still be able to get another job? So many people are kind of bound by, oh, that would be terrible. And if you're going to lose your job, if you're going to lose your life, if you're going to be thrown out of town, that's true. But life gives you second chances. And so again, do what you really believe in, but then don't be scared to follow through on what you believe in.
Amazing. Thank you, Esther. Again, it's been an incredible
Thank you.
privilege. I think you're going to see a lot of questions in the chat, and we're going to
Okay.
get all of the questions that are in the Q&A over to you as well. And it's really been a privilege, and we know how busy you are, and it means the world that you were here today.
I'm
Thank
going
you.
to stick around. I'm interested to hear. I saw most of the presentation, so I'm really excited to hear what's next. Thank you.
It's been a gift for all of us, and thank you so much for spending time with this community. So as we go into our awards, I'd also like to ask for some love and some of the reactions. I saw how amazing you all were to Esther. I'd like to also thank our incredible 4 judges who picked our winners, and also thank all of our finalists for creating their companies. So we are going to start the announcements, and good luck to all of them. So our first award is in the nonprofit category, and Mitzi, we are going to invite you to tell us the second place winner.
Hi, I'm Mitzi Crockover. I'm host and producer of the Beyond Paper Gown podcast, where we focus on women's health and the factors that impact on women's health, including what we heard today, research or lack of, policy, and innovation. And so, excuse me, so I'm so delighted to be able to offer the winner an interview with us to introduce our audience to these wonderful innovations that are being created to improve the health of women. And I just want to say thank you to HITLAB and to Susan and to Stan for the incredible work you all have done to put this together. It's really a wonderful opportunity.
Well, I want to thank you also because I know last year you kindly donated this award, and you said it was one of your most watched podcasts. So
yes,
really
thank you. Yes.
Very powerful. All right. So Mitzi, will you tell us, please, will you reveal the winner? You're going to find out as we all do. I don't know who it is.
Okay.
It'll be on the next page. So if you can announce the winner.
Okay. Comfort Weave VR, second place.
Congratulations, Mary.
Yes,
Catherine.
congratulations.
Thank you.
And now we'll go on to our first place. And Ainsley, I think you're going to be presenting for HITLAB. Could you tell us a little bit about the prize that this person will win?
Yes, absolutely. Thank you, Susan. So the first place for the nonprofit will receive participate in a rapid pilot study designed and implemented by HITLAB's research and evaluation team, as well as a 12-month executive breakthrough alliance membership, which is valued at $1,000 from HITLAB. And I am super excited to announce the first place winner is Masha Meds. Congratulations.
Congratulations.
So much, Ainsley.
Thank you. Congratulations. And now we will go to our pre-seed second winner. And Teresa, if you could tell us a little bit about what you have donated.
So the second place winner for the pre-seed group will receive a sponsorship from our FemAbate program. So this will be a custom research and design project created specifically for the winner. And they will also be included in our list of all of our FemAbate startups. So they'll be joining 60 other femtech startups into our community. Congratulations, Nawara Health. I am so very excited to be working with you on this moving forward. This is going to be such an honor for us.
Thank you so much, Dave. Thank you.
Congratulations, Ragda. Okay, and now our pre-seed first place. Chris, can you tell us a little bit about what Goodwin kindly donated?
I am happy to. I just want to note that this is a combined prize where Ainsley may want to give some input, but from Goodwin, we're giving $10,000 of in-kind legal services to the first prize winner of the series pre-seed.
And also, as Chris said, HITLAB will be doing a presentation at one of our symposium or summit, as well as an article, and then as well as a Women's Health Tech Wednesday feature. But Chris, I'll let you reveal.
All right, sounds good. Congratulations to Mary Health, first place winner. That's wonderful.
Thank you so much.
All right, and now we're moving on to our seed. We have two winners left. So Victoria, could you tell us a little bit about the second place that you've donated?
So the winner of the second place prize will win, and again, partnered with Chris, will win $10,000 US in-kind services from accounting services from Witham, and also $10,000 with Chris. With Goodwin. And the winner is Partum Health. So congrats to Partum.
Congratulations,
so much.
Megan. And now we are on to our seed first place. So Chris, could you tell a little bit about this prize as well, please?
Sure. This is exciting. The winner of the first prize will win $10,000 in cash.
And then $5,000 of in-kind accounting services from Witham. And that goes to Bone Health Technologies.
Congratulations.
Thank you so much. We're so excited.
And now we have the Audience Choice Award. This is always a favorite and always a surprise. I'd like to introduce Tahilia to speak a little bit about One Mind at Work and the award that she's giving, and then she'll announce the winner.
Yes, thank you so much for inviting us, Susan, and the HITLAB. Congratulations to the winner. I'm excited to see who it is. I work for One Mind, which is a national and global nonprofit that's deeply committed to supporting innovators like all of you, particularly women founders and leaders, through various programs and through our ecosystem approach to mental health. So we run the gamut from supporting basic science research to our accelerator program that I'm happy to share a link to, and our One Mind at Work initiative. So as the Audience Choice Award winner, we have donated $5,000 in-kind services and a 1-year membership to One Mind at Work, where we're going to work with you to help you build a thriving workplace culture that really fuels innovation and growth as you build your companies and expand. Which we think will help you attract top talent and drive your startup or your nonprofit success and boost job satisfaction while prioritizing your well-being as a leader and as a founder. This membership provides access to our community of 120 plus global companies working across industries, expertise, training, and access to best practice sessions, masterclasses, and pro series sessions that we have on a regular basis, evidence-based tools to measure and optimize workplace mental health within your organization to truly help you grow as an organization, and an invitation to our annual global forum, which takes place in Napa, California, to connect with a broad community of innovators and leaders that are also committed to workplace mental health. So with that being said, congratulations to Bone Health Technologies. I'm really excited for all the work that you're doing. And to support you and grow. And we will be in touch to connect, Laura, very soon.
Thank you so much, Tahilia. We were super excited.
Yeah, absolutely. We'll be in touch and follow up. And congratulations to you. What an honor.
Thank you.
Thank you all. And congratulations to all of our winners. And as a reminder, you will get to meet them now in our networking session. So I just wanted to do a quick thanks to all of our board members that spend a lot of time planning this. We are going to move to the networking hosts, and these are our networking hosts. You will get to meet each of them. So they will be in the next session. They're going to introduce themselves. So start thinking about who you want to join and who you want to meet in the networking session. The link's going to be in the chat. You should also have in your emails a separate Zoom. So everyone will come in and will ask, please, that you go off camera and mute yourselves just so we can meet all of our networking hosts. And then we're going to have 2 sessions after we hear about them and their backgrounds. And this is always one of the best ways to interact. We just think that it's so special about our community. We have a lot of people that will be joining in from different time zones as well, and we appreciate that. We also realize that this is a holiday weekend for many people. So very, very excited to have all of our networking hosts, many of whom were also screening judges as well. Just wanted to mention some of the upcoming HITLAB events, and also wanted to thank Nina Joshi, who wasn't able to join us today, but she hosts a Women's Health Tech Wednesday every Wednesday. And it's a great event to turn in, and you can meet incredible founders. And I'd also really like to thank Jerry and Ainsley, if they might come off camera for 1 minute just to say thank you for running this. We've had about 600 people in and out today of the event, and it's a lot to put together from the standpoint of a webinar, and we're just so grateful to have them. So can you stick in the chat, Jerry and Ainsley as well, please, the link for the Zoom, and we will keep this open for a little while as we're opening the other Zoom. Congratulations again to all of our finalists. Thank you to our sponsors, our screening judges, our day of judges, all of you for being here. We're so grateful for all of your time. And we look forward to seeing you in the networking. It's going to be really, really fun.